All right, it's 9 o'clock and I will call the meeting of the Board of Supervisors to order. Mr. Veeder, roll call please.
Leyland,
Here.
Little,
Here.
Schwartz,
Here.
White,
Here.
Shalka.
Here. Please join me in the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, we're gonna have a work session on our budget, and James, why don't you, or first of all, a motion to approve the agenda as proposed or amended?
So moved.
Second.
Any discussion? All those in favor?
Aye.
Aye.
All those opposed? Motion carries. Mr. Perry, could you kick the budget work session
You
off,
bet.
please?
Happy to do so. So I am going to change it up a little bit. Today I'm going to have Colleen with Social Services. I believe she's on. I believe I saw her on a little bit earlier. But she's going to go first, and then we're going to move into the health department, salaries, move on to capital, and then finalize with board agencies. So we have quite the schedule today. So without that, or without any further ado, I'll hand it off to Colleen. Are you on there, Colleen?
I am. Good morning, this is Colleen. Can you hear me okay?
Yes.
Yes.
Okay. Yep, well, the last year has definitely proven to be the most challenging, but yet the most rewarding year since I've been with Blackhawk County, most in due to the pandemic and trying to navigate clients through the different funding sources that are available. All the services agencies in Blackhawk County have worked extremely well together through this whole process, which has made it work really, really smooth. The overall budget that I'm requesting is actually decreasing by approximately $6,300. To date for FY 21, the administrative budget and operating budget are about right on target, so I feel pretty comfortable with leaving most of the line items pretty much the same for FY 22. The overall number of intakes have been down a little bit for the end of FY 20 and the beginning of FY 21. This is due in part to the stimulus money available for the different rent and utility programs. The outsourcing agencies are very good at applying for and have applied for different funds that are available for utilizing the funds along with the county funds to assist the clients with rent utilities. All three agencies, Eastside Ministerial, Jesse Cosby, and Operation Threshold that we work closely with, they've all applied for the grants through the City of Waterloo for the CARES Act money and Intercog for the Emergency Food and Shelter Program. So that has made our intakes go down some over the last year. The only increase for administrative funds for FY22 are for my salary and benefits, and then I am requesting a 2% increase for the outsourcing agencies, Eastside Ministerial Alliance, Jesse Cosby, and Operation Threshold. We are in our 17th year of our partnership with them, and everything just continues to go really well with that, and I appreciate all of them each and every day. They've conducted approximately 1,200 intakes for county funding to date for this fiscal year. And the only changes that I'm requesting in the amounts are just for a few line items in operating expenses. I'm just requesting a small increase of $1,000 for the room and board for motel stays. I've been utilizing this line item a little more through the pandemic, but it's still nothing like what we thought maybe it would be. And then I've decreased the shelter line item by $3,000 and the utility line item by $10,000. And then under substance abuse, I've decreased those 4 line items by a total of $1,500. And then the only revenues for the general assistance program are generated through substance abuse reimbursements. We get a few reimbursements from individuals that we've assisted with attorney fees that are court committed through the substance abuse. That's very rare, but once in a while we do get reimbursements for that. And then the only other reimbursements we most generally receive are through the interim assistance program when somebody's found eligible for Social Security. that varies greatly. That's something that we can't really predict. It's just when somebody's found eligible for Social Security, we get reimbursed for what we've assisted them with. So that one's just hard to predict. That's just up and down. So I've actually decreased the projection for the revenues by $1,500 for fiscal year 22. And I just want to thank the Board of Supervisors for the continued support that they always give for the General Assistance Program. It's definitely much needed in the community, and I just really appreciate the outsourcing agencies that I work closely with every day. So I don't know if you have any questions, but that's really...
Colleen, this is just a question on the intakes. You mentioned, I think, 1,200 intakes from the agencies to date. How does that compare?
Yeah, that's from...
Oh, go ahead.
That's since July 1st. They've conducted 1,200 intakes for rent and utility funding. That's different individuals that have called requesting assistance. They've either been approved or denied since July 1st. They actually deal with a lot more clients than that just because of all the referrals that they're doing, all the phone calls that they're taking.
How does that compare to previous years? Just curious.
Right now we're down about 300 intakes from July to January last fiscal year to July, January of this fiscal year. We're down about 300 intakes. But they're doing a lot more information and referral than what they've done in the past just because there are a lot of other funds to pull from. They've all done a great job at applying and referring and finagling through that whole process because it is way different than what it has been in the past.
Thanks very much.
Yep.
Thank you, Colleen.
Thank you.
Any other questions for Colleen? Okay, thank you, Colleen.
Thank you.
Thank you.
All right, and then next up we have the Health Department. Lisa or whoever wants to step up and.
Good morning, Board.
Morning.
The Blackhawk County, on behalf of the Blackhawk County Board of Health, I stand before you to thank you for the opportunity this morning for us to present our budget, to give an overview of our proposal. This is a most, of course, important, one of the most important policy documents that we can do as a county board of health to our budget, because that converts our values into investments and our goals into plans with dollars attached. And as the Department of Health and the board presents our budget to you this morning, I want to thank you also for your continued stewardship in our community, and note that this proposed budget continues the basic commitments that I believe we share. Thank you. I appreciate that. To be fiscally responsible, to be compassionate, to make wise investments in our future, and to be bold in reaching a better future for the next generations. And so as we begin, and Dr. Ebonye is going to present the budget, I hope that you will join with me in expressing our heartfelt thanks to the outstanding people of the department who are on the front line 24/7. With this last year, 365, well, not 365, but since the pandemic began, to keep us safe and healthy. And there were challenging times, extremely so, not just with the budget, but with just the maneuvering through this all. They kept us functioning and thriving in spite of the challenges, and there were many. We still made giant steps toward accreditation and keeping our statutory and community visions alive. The department now will present our budget. It is one that we think reflects responsibility and accountability, and it helps us through our collaborative efforts. With planning and policy development in mind, we worked diligently, and I really will have to say very proud of the staff for their work. But most important, it helps us to promote the health of Black Hawk County, prevent disease, and protect the environment for all of Black Hawk County's residents and visitors. Thank you. And Dr. Yvonne.
Thank you, Dr. Robinson, and good morning, Board of Supervisors.
Good morning.
Good morning.
Good morning. Can I get my presentation? And can I get it on slideshow? I know I normally have very lengthy presentations, but this time around I won't. But I do enjoy coming and talking to you all. Before I begin, I just, I always center our presentations around public health and the importance of public health in our community, and also differentiating it from healthcare. Public health recognized a lot of times we have to do a bit more education so people understand what actually we do that's different from healthcare. So my presentation won't be as lengthy as I normally do because of the responsibilities we have in mitigating the pandemic. Next slide, please. So with that, can I move this? To begin, the Health Department established new vision and mission. So I want to emphasize that with the Board of Supervisors today. So our vision is we exist to ensure that people in our community have equitable opportunities and resources to lead healthier, more fulfilling, and longer lives. And our mission is that we protect people in our community from health hazards to promote healthy behaviors and prevent disease. And this is definitely in alignment with what our responsibilities are based on Iowa Code 641. Next slide, please. So what is public health? As I stated, in healthcare settings, clinicians treat diseases and injuries one patient at a time. But we in public health, we prevent disease and injury. We ask ourselves, why is there high rates of chronic or infectious diseases in our community? Why is there gun violence within our community? And what is it that we can do to prevent disease and injury? So public health researchers, practitioners, and educators work with communities and populations. We identify the cause of disease and disability. So that is one of the things that COVID-19 has highlighted. I laugh very often now when I hear the average person talk about disease investigation and contact tracing. COVID has given us that opportunity to be so visible and for people to have a better understanding of what we do behind the scenes to control for actually pandemics to occur. And we implement large-scale solutions. As you can see with COVID-19 across the nation, really our goal is to do that disease investigation and surveillance and implement these large-scale control measures so we protect the health of the community. Next slide, please. So I just wanted for the Board of Supervisors to have a visual of all the things that we went through this past year. And I want to thank the Board of Health Chair, Dr. Mary Robinson, and all the board members of the Board of Health who have really been very supportive of all of our measures and the necessary resources that we need in order to mitigate the spread of COVID-19. But we were working very closely alongside our healthcare systems. When we hear that our healthcare systems, we need to make sure that we mitigate the control of the virus so that our healthcare systems will not be at capacity. That is the role of public health. We also experience, when there is protests, Black Lives Matter movement, public health also had made very bold statements because also we do believe that it is our responsibility to be able to look at the root causes of some of these social issues so that we can gain a better understanding of how our role contributes to the solutions that need to be implemented within the community. While wide-scale testing, as our outbreaks were occurring, public health's responsibility was to get those test kits to the healthcare systems and to the community so people were tested for COVID-19. And again, just mitigating outbreaks and monitoring, doing that diligent monitoring and surveillance, that is really our responsibility. And that's just what we do behind the scenes. And I think, unfortunately, that's what has created our invisibility. But I think now, because of also nationally, statewide, and locally, we also understand that in order for public health to thrive, it's important that we fund the infrastructure of public health. You don't fund public health during a pandemic. You fund public health before a pandemic so that we can mitigate the crisis. So next slide, please. So with that, our achievements, one of the things I'm extremely proud of the health department staff. The board had charged me in improving our workplace culture. We're very intentional about that. We've established, again, a new mission and vision, but we've also established workplace culture values that we try our best to be accountable for. Health equity, looking at the disproportionate impact of chronic and infectious diseases of communities of colors, and looking at the different strategies to implement. That is something that now Blackhawk County Public Health is being recognized as being innovative, an innovative department, and we've made national and state, we've received national and state recognition for that. We have a robust community engagement. Our social media followers are just, it's ginormous, and the level of engagement that we have with the community is just rewarding. And the essential services of public health, over the past several years, we've been very intentional about not duplicating services. I do believe it's our responsibility to ask, who best can do this? We don't hold to services that maybe other entities can do, or that's really their mission and vision. I do believe that our role is to be a partner and strengthen our services, regardless of whether we are the ones leading it or not. Strengthening our programs to meet the needs of our residents, that's very important because we are a gap filler. So we are the ones that, when there's gaps, whether it's within healthcare, when people don't have a medical home, they come to public health services first, and we try our best to navigate them into medical homes. One of the things that we're going to be expanding is our clinical services. We had started originally for two days a week, but because of the needs, we're going to open our clinical services Monday through Thursday, and for Fridays to be for treatment only. Our community needs assessment and health improvement plan. We partner with the healthcare systems and our federally qualified healthcare center, People's Community Clinic, and now we have a robust community needs assessment and health improvement plan. And on road to accreditation, in the midst of the pandemic, the health department staff were working tirelessly to get the documentation for accreditation. We have submitted all our documentations. We're just waiting for the accreditation board. And I am very confident that this department will achieve accreditation. Position recruitments, I have a sheet with the that I have provided, and if you can pull that, so also Supervisor Little can also view it. But it's our position vacancy update from prior year. We've made great strides in filling the board's request to fill vacancies, vacant positions in a more timely manner. As you can see, all the positions in green are the ones that have been hired. Those are in yellow are to be determined. We've posted the positions. So of the positions that were vacant this time last year, only the clinical manager continues to be vacant. And that recruitment, if you recall, I had a discussion with you all was delayed to spring 2021, primarily due to the COVID-19 response needs. So as the field of public health continues to receive more attention to from job seekers, we've experienced success in filling several positions because of that visibility. People are starting to understand what we do, but we've also experienced difficulties from competition for specialized roles such as the epidemiologist, which makes sense, you know. We anticipate to continue to face challenges in competing for professionals for public health positions that required specialized skills and credentials. That is one of the things, even at the state level, they're looking at strategies to implement. I have a very close relationship with University of Iowa School of Public Health, and most of our graduates tend to come from the University of Iowa because they have a School of Public Health. In addition to our ongoing recruitment efforts, we also continue to evaluate our operational needs to assess and determine how the health department can best utilize positions that have become vacant from recent resignations, transfers, and retirements. So we've had resignations and we've had retirements these past couple of months. Okay, next slide, please. So we're on the budget, slide 6. Yes. Okay, thank you. So upon approval of the Board of Health, the Blackhawk County Health Department is submitting to the Board of Supervisors a budget proposal for fiscal year 2022 of $5,689,313, which is a 4.3 increase from the fiscal year 2021 approved budget. The proposed fiscal year 2022 budget will be funded by $2,259,090 in operating revenue, resulting in a total property tax asking of $3,430,223. Revenue is 3.03% higher than last year. The increase included, but is not limited to, an awarded grant in chronic disease prevention, renewal of our HUD grant with City of Waterloo in environmental health program, and we also regularly seek our grant funding to help increase our department's revenue that is not budgeted for. So one of the things that it's important for you all to be aware of, because of this innovative approach that we've taken, we've had foundations that have been, willing to give us funding and support us. But also, and there's been funding that has been, or grants that normally, outside of our normal grant funding from the state that we seek out. But in the midst of pandemic, we have to also prioritize that our responsibility is to mitigate the spread of COVID-19. But I am very confident that once COVID settles, that health department staff, they're eager to get back into writing proposals for grants. I mean, that we enjoy looking for different sources of funding. Task asking is 5.24% higher than last year because of increased operating expenses and salary and benefits. So the increase in operating expenses includes, but is not limited to, expenses such as Zoom license to support virtual meetings and collaboration with departments as well as with our community partners. We have computer equipment not included in the IT's budget. This is typically covered by grant funds, but we needed to account for in expenses. Updates to our strategic plan, accreditation fees, medical supplies have increased due to COVID-19. We have health promotion campaigns for immunizations such as the flu and COVID. I hope you guys have seen some of our campaigns across town. Increased campaigns, so those are expected in fiscal year 2022 and are covered by grant funds. Health promotion campaigns for disease surveillance and investigation through our integrated testing services are expected in fiscal year 22. That's also covered by grant funds. We have health promotion campaigns for colon cancer, breast cancer, and those are also covered by grant funds. Translation services needed to meet the needs of our diverse populations in Black Hawk County. The cost of the translation services we use was based on really, when you look at the data, you can see the increase started, and it was really during the pandemic and especially during the outbreak. So as you can see, the costs have doubled. The cost for using Language Align for the past 2 fiscal years, in fiscal year 19, for example, was $3,531.67. In fiscal year 20 was $6,939.54. So the cost of our of other translations, such as documents, surveys, and forms, in fiscal year 19 was only $530.83, and this fiscal year 20 is $5,880. And then we've been fortunate. So some of our grants that we've received, the foundations, were very flexible in allowing us to use some of those monies to cover for translation services. So for me, really, in order to inform the community, and especially in a pandemic, it's important that we have to be able to get them the information in their language. Not everyone is fluent in English in Black Hawk County, and even with native English speakers, we also have to assess the degree of health literacy. And so again, I just want to let you all know is that the health department seeks funding every year outside of the regular grant funding, where we are awarded from the state of Iowa. And if we're awarded the funding, usually what happens, for example, such as Kresge or the Community Foundation's awards, we have increased revenue from what was originally budgeted. So those additional, those are things that we never know, but it happens throughout the year within our budget. So the increased revenue also decreases the amount of tasks the health department uses every year from what was requested or approved. That being said, we still must budget accordingly as if we're not receiving that revenue. Lastly, supervisors, as I've stated that this presentation will be short, the current pandemic has shown how needed public health is in our community. We must continue to build our programs to support the community and be a reliable source of information for the public. We have to protect people in our community from health hazards, promote healthy behaviors, and prevent disease. We have to keep our employees current with changes in their fields, support them with required software and hardware for them to efficiently and effectively do their job. And we have to keep our community partners involved and informed to serve our communities, to ensure that people have an equitable opportunities and resources to lead healthier, more fulfilling lives. So I thank you all, and please feel free to ask me any questions that you have.
I've got a couple of questions, Nafisa.
Yes.
First off, you've explained some of the increases.
Yes.
And some of them I think are very justifiable. I will say I was disappointed that the health department did not follow the finance director's instructions on turning in a zero budget. Any increases that you're going to have, I think this is the time and place to ask for those increases. So I was disappointed on that fact, because most of all the other departments did follow the rules. As far as you got vacancies there, I see most of them are retirements or resignations. How many of those open positions are new positions that have never existed?
No, none of them are new positions.
So they're all old positions that people retired or resigned out of?
Yes. Excuse me, Amanda? Yes, yes. Yes, I'm not requesting any new positions. These are all positions that have been budgeted.
Okay. The increase is a pretty substantial increase. I think it's about $180,000.
$180,000, 107, which line item are you looking at? Overall?
Overall, I think your increase, the 4.3%, I think is about 176,000, somewhere around there, if I'm not mistaken. Your operating budget for ending would have been FY '20, you were over in your operating budget, which again, I didn't like that either, to be honest with you. Your operating budget was over, but you balanced it by taking money away from open salaries. And that was the concern the board had last year when we had all those open positions, that money was for open positions, not to be used to offset an operating budget. But anyway, your increases this year, I can see some of them in there, but I don't know. I think that's a pretty good increase, and I'd like to have you guys take another look at it. I know a couple of the board members gave you instructions to go on need, and I appreciate that, but I still think that's a pretty good increase that we need to take a look at.
We've reviewed our budget. We've reviewed our budget with the finance director. I've reviewed it with our financial manager. And Bridget, if you can also, please feel free to discuss. This is as lean as we can get. This is as lean. I can't justify continue being lean when the pandemic isn't over. I just can't.
No, and I can appreciate that, and the health department's done an excellent job. Unfortunately, all our departments had to deal, with this pandemic this year, and then in the end result, the Board of Supervisors are the one that dealt with all the departments dealing with it in all different aspects. So
Right.
I can appreciate everything they're doing. And if you're telling me that's lean, that's fine.
Yeah.
But again, your operating budget was over in fiscal year '20, overspent, and FY '19, money was spent out of salaries that went for a car that wasn't budgeted for, computers and so forth. So I just want to make sure whatever's budgeted for a line item, it stays for that line item. And if it doesn't get spent, then it just comes back into the reserves.
So one of the things that I think it's important for us to clarify moving forward is because during the time when Susan Deaton was in this position, we were in constant communication with her, and her main concern was the overall budget, not the line items. And so, for example, when we had the additional car, we went to the Board of Health. This was during a time where we were also going through the school nursing contracts ending. So it was a period that was very, we had all these personnel that were transitioning outside of the health department. And there was a need in the rural areas to have an additional car. And so I went to the Board of Health, they approved it, and I remember I came and I presented to the Board of Supervisors, and I informed you all about this particular capital expense. And I recall Supervisor Little, you did ask me about whether, it had an impact on our overall budget or not. And so I think that there needs to be clarity moving forward. Once the health department's budget is approved, my understanding that it's under the responsibility of the Board of Health. And so when we talk about line items, does the Board of Health, we need to have clarity. And those are some of the questions that I had asked Mike to please clarify for us moving forward, so we also understand.
No, you're completely correct on once
Okay.
the budget is certified in March that your board has the authority. But me, as a supervisor that answers to the taxpayers, when I see money spent that was budgeted for salaries that were never filled, were spent on unbudgeted items like cars and stuff, then that's my job to do something the next time the budget comes around, and that's why I'm bringing it up today. So you're correct. Now, last year we had like 12 positions that were open, and the board wanted to hold that money out and keep that, and when you filled it, then we would plug that money back in. and there was some dispute on that, that we didn't have that authority. Well, come to find out, we did have that authority, and we should have probably pushed it further, because the budget wasn't certified. It's not your money till we actually certify the budget in March. But at the same token, we also expect you to not go over on your operating, which you did in fiscal 20, and you took money from the salaries to offset it. And when I see that, then that's when I've got to ask,
What caused our operating expenses? Was it-
fully aware of the authority to spend once it's certified, but the budget isn't certified yet. So we're here today, and we could be here next week and the week after that until it actually gets certified.
Tom, do you have any more questions?
No, that's fine.
I have several, Dr. Ambonnier. This pandemic has caused a strain on the health department, on all the departments. Are we better, another pandemic is going to come, correct? Do you think we're going to have another pandemic?
Don't put that out there, Supervisor Treka.
Yeah, I anticipate we will. We will see another pandemic. Are we better prepared to confront that now than we were a year ago?
Thank you for that question. This is the reason why I made that statement, that public health, the funding of our infrastructure should not happen during a pandemic. It needs to happen prior. So when our food safety inspectors are out there, assessing restaurants, that's our job, and that is to control for those kind of issues, and so I think, to your question is that I don't think that we are prepared for the next pandemic because we still haven't learned the lessons of this current pandemic, right? And so part of my responsibility is also to advocate at the state level our needs and also the funding and infrastructure we need. And so I think that, hopefully COVID-19, once this ends, that at local, whether it's local, at the state and national level, we pause for a minute and say, what are the lessons that we've learned and how can we fund our public health infrastructure better? Because we need to do that so that our hospitals actually can also continue to do their job in the midst of a pandemic. So, thank you.
Well, and on the other side of that, though, I'm kind of with Mr. Little.
Yeah.
When I saw that 5.24% increase, I had sticker shock. And as it stands right now, I can't support that much of an increase because I also believe that even if we have challenges to face, we just can't throw a bunch of money at them to try to fix them. I don't know where the other supervisors stand, but I'll just say it right out. We have to, in my opinion, is we need to trim that to a certain point. I don't know how much,
So
but I can't support 5.24%.
I understand that. I guess my follow-up to you all is that as a health department, I am saying that I'm presenting the leanest budget ever. And we are in the midst of a pandemic. And so in responding to your earlier question, how lean can we get to a point where our infrastructure does not help us to lead this pandemic? We have vaccine allocations that we're dealing with. We have, there's so many other things that we are dealing with that we have to have the necessary infrastructure to continue throughout this year. So with all due respect, this is the leanest. I don't know. I've taken into account our economic, conditions, our business community. I was the one engaged fully with the business community, talking to them. They've shared their concerns. I understand, but I'm saying also that as a health department, I'm presenting you all a very lean budget.
And I think, I appreciate the work that you've done to present what I believe and trust you as a lean budget. This has been a really trying year on all of our departments, but especially the health department, because they've been at the forefront of this. And one thing that has become clear across the country is that public health has been chronically underfunded. The whole infrastructure across the country, not just this county, not just this state, but everywhere. And that, so I mean, just at the end of the day, I cannot support a budget that does not fully meet the needs of the health department. And I think that the budget they presented does that.
You know, you look on that same accord, you look at what's going on across the United States, all the money being more or less thrown at the wall is what it's being done, thrown at the wall. And what's it solved? Not very much. It's an atrocity what's happened, even for our county. I see this morning, I get reprimanded by the sheriff because I ask questions about something, and there's only 300 shots available. Is that true?
Of Moderna, so we've only, so this week we've only received 300 Moderna vaccines.
That's a crying shame that we were promised all these shots and nothing's, and I'm not blaming the
Yeah,
local.
I understand.
Understand, not blaming you guys, but Ms. Leyland and I were just talking before the meeting, what the hell is going on? Why is this so far behind? Something needs to be done. Somebody up above needs to take control of this, and you can throw all the money you want at anything and you're not going to solve the problem. Look at the millions and millions of dollars that have been spent on other, cancer and stuff. How far ahead are we with that? Not very far. We're still in square one, as far as I'm concerned. But I agree with you. It is probably lean, but we have to answer to the taxpayers, and I don't feel comfortable answering to the taxpayers with that increase.
So one of the things that I've heard is how also elected officials respond to taxpayers. But when the taxpayers don't get their public health needs met, we get the phone calls. Our phone calls are through the roof about vaccine. Our phone calls are through the roof about COVID-19 testing, positive, what to do. Mm-hmm. So as much as you all respond to the taxpayers, we also respond to the taxpayers. And I think that the best approach is for us to have a partnership, not siloed response, but a unified message to our taxpayers about the importance of the services. Because what is happening now is that the social and economic conditions of our society, those needs, COVID has exacerbated it and has highlighted it. And so taxpayers, when it comes to economic issues, they're calling you all. When it comes to health issues, they're calling us. They're calling the healthcare. When it comes to mental health, they're calling behavior services. There is a social and economic crisis at the county, at the state, and in the nation. And so I think this is where, for me, the message is about partnership, so that they also understand the investment of their taxes. And that's something I'm willing to do. But I think that, I recognize that those same taxpayers, they are calling us all the time, every day. And so we have to be accountable to them as well.
And on the other hand, you don't get, and not saying this about you guys locally, you get a different answer every time you see something on TV. It's a different answer on it. We've got 4 people in our AMVET club that have come down with COVID in the last 24 hours. I don't know if they're in the numbers yesterday, but they're in a small. They're our honor guard.
Yeah.
It's a crying shame that anybody's getting sick, but my God, we've got. And what have we solved by, where are we at? What have we solved with throwing this money at the problem? I agree, we got to work together, but we're not going to get any help from up above, so we're not going to solve anything. As far as I'm concerned, they keep throwing money, you can throw all the money you want, give out these checks to people. You're not solving a problem there. As far as I'm concerned, you're creating more problems. They didn't think some of this stuff through very well. And I'm not blaming the local agencies or anybody, but it's not it hasn't been done right. And I agree, you're getting calls, but we're getting calls too, and we get calls on other things. I get calls on I know the mental health side of it. I sit on that board, and it's out of control too. And I can understand why. Dan was saying this morning that he was on the edge. Everybody's on edge because of everything that's going on.
And Supervisor White, I share your frustration with the money that we see being wasted, but that's coming from people in the federal government that have no connection with what's happening in communities, and people at the state level. I mean, the governor has been reprimanded multiple times during this pandemic for misallocating millions of dollars to be spent on HR software, to be spent on state troopers that had no involvement in COVID response. And so that's where that frustration is. But this is where the rubber meets the road, where we're directly connected to what's happening right here with our own employees that are very accountable, that have this accountability that we don't have from the federal and state government.
Any department could have come forward and said, listen, we've got these extra expenses because of COVID. And public health is important, but again, I can't support 5.24%. Supervisor Leyland, do you have any comments you want to add? I don't know basically where you stand, but
Well, I appreciate
it's good to
all
air
the
this
comments.
out.
Yeah, it is, and I appreciate the comments. I agree. I'm sure they did everything they could to present what they feel is the lean budget. I do support the partnership aspect of it, that we maybe need to work closer together. And this isn't the time, obviously, a pandemic. You've got many things to address, as well as accreditation and just doing your day-to-day services. But if it's understanding budgets or expenses or issues that we have throughout the year, I think then we should try to resolve those. I don't think we've looked at our budget yet as far as overall how it looks and where that places us. I know James has been working on some of those things. And I guess I'd still disagree. I know, Tom, you keep saying that the departments should have done a zero increase, and that was never my stance on it, and we didn't vote on it as a board to say that that's what everyone should do. I still believe strongly that our departments bring to us what they feel is a lean budget, and they're all very responsible and usually are always considering the taxpayers when they bring us budgets. So I don't feel we ever end up with a lot of a wish list type of thing. So then it's our job to, if we want to pare things down or don't like what's there or feel there's some places we could look at, certainly ours to say, hey, let's take a look at this again. So I'd really like to see where we are budget-wise, what this does to us with all the departments, and after the capital list we look at today, and see where we're at before we start to make cuts. I know, just looking at the list of expenses that we had, and this would just be a question I'd have as we look at things that were increased so much from last year. And it's not that it's a large amount, but looking at utilities, I saw there was like a 37% increase. Well, that's and I guess because we're considering solar out there, typically I'd think like, okay, our solar, we're hoping goes down, that wouldn't increase. I know there's no guarantee of that, but are there places like, that we could take a look at and adjust? Maybe not. Maybe you have other things into that, and certainly rationale, but that's something, maybe.
Our janitorial services also increase. So those are, those are things because of the pandemic, the increase in wiping and all that stuff. And so, and some of the other expenses, like I said, it's covered in grant funding. But, I've always been willing for James to look at it and give us, his assessment. But that's why I said what we presented is something where both myself, the financial manager, and having James review is so lean. I would need some of y'all's recommendations on where to cut.
And that's what my point exactly is, that maybe you had those conversations with James.
Yeah.
Maybe us not looking at that 5% increase and understanding exactly
Yes.
what those items were. So whether we're responsible, the taxpayers or ourselves, to say, oh, okay, that makes sense to us.
Right.
Maybe we do need to leave an item in. Otherwise, I'm, like I said, more than happy to consider items if there's particular items the board has in mind, and just asking for justification if that's the case. Or are we thinking?
And hopefully your new finance manager understands that money isn't yours. the last 2 years, you've been, like you said, not just last year, but the year before, money was spent that were, for other things that they shouldn't.
I think that's where we need clarification on moving forward.
Yeah.
When, after that budget is certified, like, who manages it, and then what's the process? Because I've been told that as long as I come and update the Board of Supervisors, that's okay, but it seems like that's not okay. So I need clarity on that process.
I think I'd be okay if I was informed, but I don't believe I was ever informed on these last 2 years, what was done at the end of the year.
And I think there are some individual philosophies on it.
Yeah.
Mine
Yeah.
is, once the budget's certified,
Yeah.
it's yours.
Yours.
And that, technically, that's the way it is. I would, too, would like to be informed.
Yeah.
But also on the flip side, with the overall budget, if, my philosophy is, okay, I'm looking at it, I think it's too much. The board could come back and say, if you don't bring us back a budget that the majority of us are comfortable with, the board does have the authority to say, okay, we're gonna cut $100,000. And it's up to you to
Right.
decide where to cut that $100,000. It's not our job to tell you, okay, take it from here, take it from there, take it from here. As a department head, that's not what I wanted.
Yes.
I didn't want elected officials to micromanage my operations. And I'm
Mr.
not
Chair.
trying, as an individual
Yes.
who's elected to this position, I'm not trying to micromanage your operations.
Mr.
And
Chair,
for-
could I say something?
Yes, yes.
Linda's right. The board did not vote on how do we want it. I mean, James didn't get this out of the clear blue sky. He got it from, he thought the majority of the board, and in the future, we'll make sure that we give James proper authority on what we want. And Nafisa, again,
Yeah.
all this discussion today is it's, as far as the Board of Supervisors, it's our job to ask these questions.
Yes, yes,
And to go
yes.
through this. And I see there's other reasons why I ask these questions. First off, Craig was talking about the spending, and you said you need clarification. As far as with me, if I give you X amount of money for a position and you don't fill that position, but you spend that money on a car that wasn't budgeted, then yeah, you have the authority to do that at that time, but I also have the authority the next time you come to me for a budget is not to give that money to you. Because it's deceiving to me that you wanted it for a position, but yet you spent it on a car or on furniture. I also had employees tell me the end of fiscal year 20 that their department had came around at the end of the fiscal year and said, do you need anything? We have extra money, we need to spend it. Now,
I'm sorry.
now I understand you do have some openings through retirements and through resignations, and apparently there was some concerns on things running over there. But I personally has been contacted by employees, and some of the other supervisors have too, that a new hiree told me she sat at her desk for 6 weeks and didn't have anything to do. She had no job instruction or nothing for 6 weeks. And this all happened this past year. I've had other employees, and again, there's other supervisors. I think that's going to improve now because you've had some retirements, some resignations, and you're going to get some new people in leadership roles there. So it kind of gets back to what Craig was saying. You can't continue to throw money, and I'm not talking about you or the health department,
Yeah.
any situation. You can't continue to throw money at the problem rather than maybe getting more efficiency out of what you got. And that's what I'm looking for, and that's what I'm hoping for with the new positions that you're going to be filling through retirements and also resignations.
So Supervisor Little, again, to go back to that capital expense of the car, I did inform the Board of Health, and we did inform the Board of Supervisors. The second thing is that the Health Department is very intentional in seeking outside grant funding. So there are funding that we receive that we intentionally seek that normally would cover property tax expenses, but because we went and sought out for this grant, it covers those expenses. So we haven't been able to do that more this year because of the pandemic. So that's why sometimes we have, so basically what I'm hearing is that even if we have extra funding that covers for property tax, those expenses that are budgeted for taxes, we actually should use that money for other things that we need, instead of supplementing those for the things that the taxes would normally cover. We go out and get money that helps with also property taxes, so that our expenses.
The health department's done that forever. What percentage of your current budget is grant money, and what percentage is tax dollars?
Is it the three?
Because at one time, 1/3 was tax dollars and 2/3 was grant. So at this time,
All
this current
grants.
budget, what is grant money
Yeah.
percentage and what's tax dollars?
So the revenue is our grants. The 2 million.
What percentage of your overall
About-
budget is grant money?
It is the 3%. How much is? Hold on, Bridget is doing the calculation.
Because I know at one time over the years,
Do you want for
the health
fiscal
department's budget
22
was,
or fiscal 21?
was 2/3 grant money and 1/3 tax dollars.
That's what it looks like up there.
Does he want fiscal 22 or fiscal 21?
Give us fiscal 21,
Okay.
please.
And while Bridget is calculating that, please, with all due respect, if an employee calls you as an elected official, I think it's the responsibility of supervisors also to refer them back to the proper channels. Because this is the first time that I'm hearing that an employee is complaining to a board of supervisor that they've been hired and they've been sitting at their desk for 6 weeks. That doesn't help us. And I think it's important that I get that information and they're referred to the proper channels, because that's actually inappropriate, in my opinion.
And actually, all that happened last few.
You broke up, Tom.
Since then, you've had a shakeup with employees retiring and resigning that probably indirectly were the supervisors of the different employees.
I didn't.
Dr.
But I
Nwomi,
agree with you, and that would have happened too, Nafisa. I do agree with you on that.
Okay, thank you.
But I do expect any employee in Blackhawk County, if they want to contact the county supervisor, they certainly have the right to do that.
When we, I had this question for some of the other department heads about, and while she's factoring this, open positions, it looks like you have about 7 right now. When you have an open position, how difficult has it been for you to fill? Are you finding candidates with the qualifications you seek?
So prior to the pandemic, it was very difficult, prior to the pandemic. Again, some of these positions, like the epi position, that was very, epidemiologist, that's a very specialized field. That was very hard. The public health nurse position, I think that, we've been fortunate that, maybe some of the nurses don't want to work within the healthcare systems anymore. And so we've been able to get applications, but the competition was very hard because, the nurses, they get bonuses within the hospital settings that we don't. And so we try to advertise our benefits and so we adjust for those kind of things. There are some positions that are much easier to fill, and we do that very fast. But again, nurse practitioners, that's a field in demand. So we've been very lucky to even be able to have 2 at the health department. So it all depends on the position.
And some of these positions that are open, how long have they been open? And what I'm getting at here ultimately is, you see, the problem I think we have as a board is that we tax to pay individuals to be in that position. And as we move forward, if that position is open, we have taxed We have asked our citizens for funding to support that position, and then it doesn't get filled.
Yes, so I think that also is, based on the environment. I mean, Iowa overall is looking to sustain, people instead of people, people leaving the state. And so for us, I think it's not something that necessarily the health department can control. So those are some of the things, and.
And I can speak to some of the, you asked about.
Sure, Amanda, if you could come on up to the podium so we can hear you more clearly.
So, just to reiterate what Nafisa said, this is, especially the specialized roles, we see that in other departments too, we have at times those recruitment periods extending further beyond than a month or so. But, what we do when a vacancy occurs, and this is with any department, is that we sit down with that hiring manager and we kind of develop a plan. And we said we need to review the job description, because some of these haven't been vacant for a long time, needs to be revised, and at times the organizational needs have changed, and therefore we need to kind of rethink that. So, but typically, the health department has done a tremendous job this past year as making position vacancies a priority. Since I've been in HR, I've seen a drastic change of focus to making sure that those are getting filled in a timely manner. But we still at times do face challenges, especially as we all know with leadership roles at times or management roles. Those can be difficult to fill. Just with Blackhawk County, at times we have not always the strongest pool of candidates, and sometimes we have to extend those recruitment periods out further.
Not to interrupt you, but
Sure.
no doubt with an epidemiologist, it's hard to fill that because of the amount of money they could make in a bigger town, or a
Exactly.
bigger county,
And
or at the state level. How many does the state have? How many epidemiologists does the state have, do you know?
I
Oh, it's
don't know.
Why do we need two?
That was the COVID-19 response, and just the need for two. I think they came back in, what was that, August or September? You can speak to a little bit more specifically.
Tom, we haven't forgot your issue with the
Yeah.
revenue. We got a little
She's still working
sidetracked
on
here,
it.
but they're still working on the numbers.
But the, our rates of disease is high in Blackhawk County.
Okay.
I have stated that since the beginning. We have one of the highest rates of infectious disease in Blackhawk County. We need the epidemiologists. So that's their role, that disease investigation and surveillance.
Someday when you got time, I'd like to sit down with you and you explain to me what all they do.
Oh, yeah.
Yeah.
It's pretty complex, but
Yeah, I can-
the need is there. The need is there. And that is why supervisors from, since my hire, we've been very intentional about looking at what our true role is. I wish some of those questions were asked when we had the school nursing contract, so I could come in and not have to deal with this. But that is the truth, is that we spent a lot of time on providing school nursing services over the years and not really focusing on our essential public health services. So that's why I even stated during the time of the restructuring, when we were getting kudos for the layoffs and, subcontracting home health, those are all things that should have been done 10 years ago, but they weren't. And so now I'm in a place where I'm asking you all the support, because we're in a phase of rebuilding. And we have to rebuild given the current situation here that we're dealing. We're focusing on the essential services of public health. What public health does is what we're focusing on. So Bridget, please.
So for fiscal '21, we had 41% of our budget was grant funds, and about 59% was covered by tax.
Are you hearing? I'm Bridget, I'm sorry. Tom, are you hearing that okay?
No. Yeah, that's really changed, because if you go back a few years, it was 2/3 grant and 1/3 of tax dollars, and there could be various reasons for that, grants drying up and so forth.
One of the big grants that we no longer manage is the
Sure,
response
I understand
grant.
that. This year too, maybe
Probably
even
through
more
people.
so. And again, Nafisa, I don't have a problem with positions. The only problem I have is if you ask me for money for a position and you spend that money elsewhere, that's the problem I have.
Yeah. So I think this I'm going to defer to Dr. Robinson, because I would like to flesh this out.
And this isn't the only budget. I've got a concern with other budgets too. Most of the budgets came in, but there's one more other budgets that I won't support either along with this one.
Board of Supervisors, I'm hearing some things that are disconcerting to me. I have a history with the board on and then off for a while, and then you asked me to come back on. And I know that there was a history where there were issues with the supervisors, the Board of Supervisors, and the Department of Health under a former director. And we went through things like this. When Dr. Nafisa said that there are some things that we need to have clarity on, that's an understatement as I'm listening to this. I'm really thrown back that if staff has come to a Board of Supervisor member and the director hears about it for the first time here at a public meeting, that's not good. And let me just share with you how we resolved it, and I'm going to recommend that, if you're willing. We had a joint meeting of the Board of Health with the Board of Supervisors. They were able to get clarity on some of their issues, and then we were also able to get clarity on some of our issues. It was a great discussion, a great time. And as a result of that, we ended up with the liaison position coming, and so that we felt that at least someone would be at our meetings, would know what the process was, would know what our deliberations were, would understand what was going on with us, and that person was our liaison. At this time, I'm really feeling a need for a joint meeting again, so that we can talk about where we are from our perspective. You can talk about where you are from your perspective. I think that there are some things that we feel that we don't or do have authority for that you may not agree with that, and vice versa. And I highly think that it's time. If we've gotten to the point to where a director has to hear something about staff for the first time at a public meeting, that's clearly well beyond the pale. And I've been wanting to call for this meeting, and I'm glad I was here this morning, because I really would like whoever it is that I'm to talk with, so that we can do what we've done in the past, and it really helped us. I'm sorry we've gotten to this point. And Dr. Nafisa and the department struggled very, very much so in the height of a pandemic, and you keep talking about other departments are struggling too, but this happens to be the health department, and that relates more to the pandemic than any, probably, of your other departments. We did not ask to be in this position. We are in this position. None of us did, and we have to deal with it. But we have to deal with it in a better way, I think, than what I've seen this morning. And so I would request whoever I need to talk to, if it's you, Chairman Trecca.
Yeah, I think it'd be good if we have a joint meeting with HR there and county attorney, assistant county attorney Mike Treenan. I think the only question is how soon do we need it? Because right now our priority is we're in the thick of the budget.
I get it.
So I'll confer with the other supervisors, and I'll be in touch with you and
Okay.
Dr. Mbonye, and we'll set something up.
Okay.
Because that'd be good. Communication is good.
That's
And the discussion has been good. I mean, I love transparency. I like how we're vetting all these issues out. I know it's a concern with the employees, but again, that's a double-edged sword too. We've had some delicate issues that employees have brought to the Board of Supervisors' attention that they have protections too in regard to being whistleblowers or whatever they want to be considered. So as individual supervisors are given this information, they have to try to filter it and vet it and see exactly how it should be handled as well. But I do agree that a joint meeting would be beneficial for both bodies, and we'll get something set up, and I'll be in contact with you.
And you also have to take it in context
Yes.
that when we hired the number one job description that was given to whoever the director was going to be was that the department had to be reorganized.
Yes.
And do you not think that that's going to come easy? No, everybody wants reorganization until it impacts them.
Yes.
Personally. And so, but for us to hear this, and understandably, I could probably I could even understand that, because if it was going to impact me personally, I would have some concerns, and I would be reaching out to everybody and anybody that I could. But this is not the way to vet those issues.
No. And I remember well when Nafisa presented her first budget, well, the first budget where she was working through the restructuring and made all the cuts and the many cuts and the reductions, and warned us, kind of forewarned us that she was going to have to rebuild, so not to expect those cuts to be permanent, and that we were being leaner than ever, that we would have to rebuild and there would be costs. But I couldn't agree with you more that we need a joint meeting of the two, and a liaison maybe has a role with the health department, but as you see and know very well, that there are 5 of us with 5 very different philosophies, management styles, communication styles, whatever, and so I think it's necessary for us to have that opportunity, and hopefully all of us would attend.
Great,
We'll get it set up.
great, awesome, love it, thank you.
Thank you.
Thank you, Mary.
Where were we?
I'm smiling.
Where do we want to go with this? Yeah.
Where were we?
I've gone through a dissertation process, I understand.
All right. Any more questions for Dr. Mbonye?
I guess my question is for Ward. I mean, we've got our health department in the midst of the biggest public health crisis that we've faced in 100 years. So I think anybody would expect that there's going to be, increased expenses. We were forewarned, as Supervisor Leland said, that going through the restructuring, that things wouldn't permanently be down, that there'd be possible increases as they finish the restructuring in the coming years. And so I know people are saying that they don't want to micromanage the department and tell them what exactly to cut, but they're telling us that they've given us a lean budget. So I'd just like to know what it is, if supervisors aren't comfortable with this budget, what they think should be cut out of it, since they're telling us that they've given us this lean budget as well already.
Well, I'll just throw out a number. It's not my responsibility to go through it line item by line item, but I will if that's what the health department asks us to do, and I will do it individually, and then I will come back with a proposal where I say, okay, this is what I think you should cut. But I'd say $50,000 to $100,000 from that 170,920.
Where, okay, tax asking, I see. Your increase, though, was like 140,000, was it not?
Yeah.
Okay, the 170.
And that's just me individually. That's I don't know how the other supervisors feel about that. This is a majority rule board, but that's where I am.
So Supervisor Trucca, when you throw a number like that, what do you base your decision on?
Well, I look at all the departments that I've reviewed, and I've reviewed all of them. And, and I go back on, I had a 30-year law enforcement career, most of those years as a chief. Crime is up across the country right now. So if I was still a chief, I could come back and say, hey, listen, crime has gone up 10% in my community. I need to increase my budget 5.25. And that's happened where I've had significant events throughout my career as a department head. I never came back with a substantial increase in my budget. Every budget that I presented as a department head generally was in line with the other department heads. It was 1% to 3%. Because as a taxpayer, I expect my taxes to go up every year, a reasonable amount. I don't want to see my taxes go up every year 2%, 3%, 4%. 1% or less I can live with. I expect that. That number used to be higher until I retired. But now when I look at my income compared to how it was when I had a career, I've become more fiscally conservative.
Yes, but I don't think, with all due respect, that crime has reached the level of the COVID-19 pandemic. I think that, crime, just like with other chronic illnesses or, infectious disease, maybe fluctuate, but we're not done with this pandemic. There's even talks of COVID-19 variant virus. I'm just, this is me forewarning, this is me doing that because we're not done. Even with the vaccinations, we're still telling people you still have to wear a mask, you still have to socially distance. And so I think for me, when people are celebrating 2021, I'm looking forward to 2022, 2023. And so that's something that I think it's important to take into account. I want, again, the supervisors to really take into account that the fact that we also get calls by the same taxpayers that do call you all. And my recommendation will be talk to your county supervisors because it's gonna come to us and we need that infrastructure to be able. That is why even when before COVID, I came before you all for planning, like there will be like, the first case and everybody's gonna want information. We immediately got that website going, so there are things that we need that are immediate and we have to get it done, and so I just want, when you're making those decisions about a number, I want it to be based on data and the needs of the health department, but not based on this is just what you guys should do, because that's going to be hard for us. And I will come back and say, we need to do some kind of budget amendment or something because, and that's what I'm trying to avoid. Now, the good news is that, again, in the midst of this, we are seeking additional grant funds. Throughout the year, we get funding from, the state at times, and so but we have to present a budget to you all without those in mind because we might or we might not, but we are intentionally always planning for additional grant funding to come in. Thank you.
James, could you put the salaries back up, the positions up there back on the board?
Yeah, that was Kim.
Okay, that one position there, and I don't know how do you say it, epidemiologist?
Yes, epidemiologist.
Is that a second position or do you currently have one now?
We have one epidemiologist, but we need another epidemiologist.
Okay, what's the salary on that one, James?
Yes.
Hang on, let me look that up here quick.
The GS 718. Amended.
If I'm correct, is that the only new one? The rest of them are retirements or resignations?
Yes, and this one was, remember during COVID, we came and spoke to you all about this position.
How long's that been open?
That's been open since, we made 2 job offers, but they declined.
And the clinic manager, is that a new position?
No, there are no new positions in this spreadsheet. The clinic.
Well, that epidemiologist or whatever it is, that's a new one, isn't it?
Which one?
Yeah.
Epidemiologist.
The epidemiologist, yes.
Okay, James, what's the salary on that?
So we currently budget about $62,000 for the salary on that with.
I can't hear you.
We currently budget $62,000 for the salary with complete benefits, IPERS, FICA, workers' comp, all of it included. We budget $98,700.
Going along with what Supervisor Trucka said, that would be the area that I would say that we'd eliminate that for this year's budget.
An epidemiologist being eliminated
yeah.
during a public health crisis? I'm sorry.
We currently have one, is that correct?
Do you understand what an epidemiologist does, Supervisor Little?
I made my request, Supervisor Schwartz.
I'll take that as a no.
Yeah,
All right,
I think we,
It's like I said though, so, you know, you can have all the people you want and all this stuff. It's not solving any, right now, we're not seeing any results of it. Not you guys, but at the federal level, all the way down, there's no results being showed. We're supposed to have how many thousands of shots in this county? We don't see any results yet. There's people dying every day that I feel responsible for because someplace along the line, we didn't do our job right. Because these people, these elderly people, and a lot of other, the frontline people, you see in these, when they show on TV, people in high places are getting these shots. Why in the hell are they getting them before the elderly? There's some stuff going on, not at this level, but that isn't kosher, I'll tell you that.
The epidemiologist does disease surveillance and investigation, and it is a critical role for the agency. It is.
Nafisa, do you have another area that you could pull out of the budget rather than that one? Because I think what you're hearing is the board, some of the board members are looking to cut that down. If that's not an area, do you have another area that you could cut back on? I mean, you guys can either do it or we can do it.
well, can we take a look at the overall budget and see where we're at in a few days, I guess, and see exactly where this puts us and where we can look at our
What we need
options?
to do.
yeah, I think, you know,
Yeah, let's wait till
we're
it's all done.
being presented all the information, we're
Yeah.
absorbing it. This was, I think, very good discussion. We aired out positions and philosophies and where each of us stand. And we come back later, and, but Supervisor Little makes a good point. I mean, you're getting a sense here, I get the sense that the majority of the supervisors have a difficult time supporting 5.24 in the future. So you need to make a decision. Either you try to trim that. If you can't, it sounds like we may. And if you can't do it with a number in dollars that we present, then we will make the decision as to where those cuts will be made.
Okay.
So
And
we're-
I think that joint meeting with the Board of Health is definitely necessary. But I will say this, during this pandemic, the same sentiment that Craig, Supervisor White, you have of the people that have died, the people that have suffered, I am presenting you all a lean budget, and I do not want to take responsibility of cutting a critical positions. Everything that I have evaluated are critical, and it's not going to fall on my hands. It really isn't, with all due respect. I am very surprised at this because, like I stated, years ago, when this should have happened, it didn't happen. And now when we're at a stage of looking at the critical needs of a health department, where I'm asking to cut these critical needs, when my intent has never been to duplicate. My intent has always been to strengthen our services so that it reaches the populations. So it's really, we're getting into a delicate place.
Yeah.
I would defer to the board on this because I present to the board the budget.
Thank you.
Mrs. Fessenmeyer, you stood up. Did you have anything you wanted to add?
No, just, again, only that right now, you know, we are with the epidemiologist position. I don't want to see us get in a position where we are actively recruiting for that right now. I have seen other entities where you get to a point and a board, you know, ends up eliminating a role after someone's been hired. I just want to make sure that we're aware of that this is one that it's actively being, actually, only really the ones in white on that list. And they've done just a great job to really evaluate their organizational needs. This is the positions that are really going to support the health department through this next difficult year too. So we've been evaluating those every time they come up, and that epidemiologist is pretty critical.
Amanda, why, you said there was 2 applicants that turned it down?
Correct.
Did they give any reason why?
They took other one was like an epidemiologist role typically. They were taking other jobs in other cities. Like you said, we're competing at a very high level.
Yeah.
And this is a unique set of skills that we're looking for, very specialized educational credentials and experience, and we want to find the right person because they're going to be dealing with all of our population here in Black Hawk County. So it's a very rigorous recruitment.
Are we
And,
realistic with our salary and
Out on the
benefits
position,
package?
we're not talking about the position. I think what the board is talking about, members, is we need to trim the budget down. So whether do it, that's it. So I mean, I would like to think every position on there is needed.
And Linda, it was evaluated on our factor analysis and looking at the compensation, and we have been able to attract applicants. It's just we're in a difficult spot with that. This is such a highly demanded position right now across the world, honestly. So
Yeah, you got people in nursing home. My granddaughter works in a nursing home in a small town around here as a CNA. And she has a lady that's 70 years old that come back to work as a CNA. That's a crying shame when people, 70-year-olds got to come back. Not that she needed the money, she was concerned about what's going on.
sure, yep.
And she probably hasn't got the shot yet either because she's in a small town.
Thank you.
Thank you.
Thank
At,
you.
at this point, any more questions or comments in regard to public health?
I just want to make one comment. However it is decided, whether there is going to be a cut and how that cut is going to be, I come back again, like a broken record, I suppose, saying that I can see just from the suggestion of cutting an epidemiologist during a pandemic, that gets me right back to where I'm saying there needs to be understanding. Because of all of the roles or staffing within the department during a pandemic is not the time you want to be short an epidemiologist. They are absolutely critical along with the contact tracers. And so I'm going to come back again and say we need to be very careful, board, what we're doing. We're not talking ordinary times. We're talking very difficult times. So I really want to get that meeting scheduled as soon as we can so that we can get some clarity here.
Yes, ma'am.
Yes.
Thank you.
No, and
Linda?
I appreciate, no, my comment was just going to be, I think while taxpayers and the finances are very much our responsibility and what our role is to the taxpayers, but it is seeing that the services are provided to our community and to our residents that we need. And much to Craig's point, feeling responsible for deaths and people not getting served, I think we need to make sure we're just, however we all feel, we need to make sure we're doing what we can to meet those needs in our community and address that. So that's.
But on the other hand too, Linda, say the epidemiologist, we don't find anybody, so then what do we do? No?
Yeah, as far as how
Yeah.
open that would be for
I mean, there's only so
funding a
many
vacant
people out there
position.
that got those qualifications. I could be.
Mr. Chair, I suggest that we also have maybe James go through the operating budget and see if they want to leave that position in there. That's an option. The other option is to reduce some of the other line items. But just
Well, maybe we need to do that with several budgets, or at least take a closer look at everything. If we're looking for a particular targeted dollar amount or something we'd like to reduce, I guess not just
When
one
I told
department.
James I wanted to see it, when I talked to him before this all started way back in the summer, that I wanted to see a zero increase in taxes this year because of COVID. And I think Tom did, and
Zero
Yeah, and we had-
increases in taxes, I think we'd all be happy with that, like I said,
Well,
we
yeah,
can do
we-
it. So
yeah.
it's just like, if there's ways to look at that, James and I've had that conversation as well. I said it'd be great to be flat if we can, but, yeah, and not increase taxes, because we've got so many residents out there that are struggling, and paying taxes is difficult too, but we still have to meet the needs of our community, so I want to be sure we're doing that.
I think the bottom line is, Linda, the majority of the board right now is in agreement of reducing it. So
Well, that's why I would like us to wait at least till the end, take a look at where this all places us, places we can cut or places we're not, Tom. I just don't think to jump in and do that now is a little premature.
I'm not in favor of doing it right now.
Well, this is all, it's good time to digest it, and what adds sensitivity to it is I just paid my tax bill,
Yeah.
and many people are sensitive to that as
Another one
well.
due in
So
March.
it was a good discussion.
Thank you.
Thank you.
Thank you.
Thank you, Mary.
Mr. Perry, what's next?
Well, I will say too that I would urge that we do kind of push for that meeting sooner than later. And if we're not for giving direction on this particular department budget today, which is fine by me, given the current schedule that we have, I would urge that we do it very quickly. So
How does it look next week? As we have several invested partners here right now, can we schedule it for sometime next week? Monday's a holiday, but maybe a good time would be after the meeting on Tuesday or after the meeting on Thursday. I agree that it's a priority.
And I also would need to contact the other board members because we definitely would want a quorum. And so we can talk. I don't think we can set it, at least from our board schedules right now. I cannot speak for the other board members.
Well, why don't we tentatively say a week from today for a time to be determined in the afternoon?
I think James was talking about wrapping it up Tuesday. I thought this was going to be our last Thursday.
You need it sooner than that, James?
well,
And actually, next Thursday would not work for me at all.
Well, actually, why don't we wait and see what Tuesday looks like? I mean,
Right.
you've got to put budget stuff together. We need levy information. We need to look at the whole picture of what this means for us with these things.
So on the schedule that I provided, next Tuesday, I have us publishing for the max levy hearing. Now, because we are doing this on a very expedited process, we can push it back a week, and then therefore I will not be requesting for the publication for next Tuesday. I could do it for the following Tuesday if that's what you guys decide to do. But again, as far as the max levy goes that we need to publish, I will need direction for this budget specifically. So
So how does that do for your timelines? I mean, as far as giving you time to,
that should be fine. If we delay everything a week, I should be fine for my schedule. So that will not be a problem. If we want to schedule something next week, that works for me, and then we will just look over the max levy publication on not. I don't have a calendar in front of me.
see, Tuesday.
Right there, James.
Yeah.
I can't see that. Craig.
Good.
So instead of the 19th, looking at approving that publication, we'd be looking at the 26th, which again does that would be fine.
Okay.
That'd be fine.
I kind of like that anyway because we're off Martin Luther King.
Yes.
And, so it catches everybody kind of a day there to.
I
Well, we
agree,
don't know
that is good.
They're going to be available the 19th, yeah.
And the rest of the board, right now, unless they were watching it on Zoom or something, has no idea of this particular discussion, so I need to contact them.
Well, that's why I said we can get that week that James is talking about. It doesn't give any hardship to you. then
Nope.
that's
How about our supervisors? What is everybody's availability next week? Sounds like Thursday does not work, but, because I'm
Wednesday would. I don't know what Wednesday looks like for you.
Wednesday and Wednesday, the next two Wednesdays after that don't work for me because I
Yeah.
got mental health meetings.
Yeah.
would
Wednesdays.
time make a difference if it was morning or afternoon? Does that help?
Yeah, well, it depends on how long they last. Lately, they've been lasting 2 or 3 hours. The 20th would be, I'd say, afternoon. Next Wednesday afternoon, I'd be available because we Zoom or we're on
Next Wednesday. would?
Pinecrest for that one.
Can we
But the next
tentatively
one
say
is
next
in-
Wednesday at 2 p.m.?
I will get in touch with the rest of the board, and Wednesday works for me, next Wednesday, the
And
20th.
James, that should be good maybe for Tuesday to be a real intense kind of get our budget information and have as much as we can going into it so before we meet or something here.
Yeah, when I summarize the levy information on Tuesday. The only thing that would differ from that would be any direction as far as this
Yeah.
budget goes, and then any direction as far as capital. So after today's capital discussions as well as salary discussions, I can update everything, and then we can get things taken care of real time as well. So again, that would work for me. So
Okay, good. Tentatively Wednesday at 2
Okay.
PM.
Tuesday for you, Wednesday, yep, okay.
What are we actually going to do Wednesday?
Well, we don't know yet, yeah.
We don't know.
That's a plan.
We'll get more information.
You
Well,
know,
more
this ain't the only budget either. There's a couple other budgets got concern of that we wanted to discuss, or I do.
Yeah,
Medical examiner is another one that had an increase that I think we need to address.
yeah.
I agree.
And there was, I think he stopped in the other day.
I
talked
thought
to
if
a
he was
couple of us.
comfortable with whatever we wanted to do, but.
And and James was talking to Billy and getting some numbers maybe for us too. I
Yep.
think, even for us to look at, but yeah, that's definitely one.
What's the other one, Tom?
Which other?
Yes, Tom, is upcoming discussions we're going to have, or departments we've reviewed in the past? I think you wanted to talk more about capital, correct?
Yeah, hopefully we make a decision then next week.
Yes,
Yeah.
yes, I
Monday or
agree.
Tuesday.
Well, then, I'm seeing the way the conversation is going, we're pretty much talking budgetary items. My conversation was also overall.
Yes.
So we would have to schedule another meeting later on for overall as well.
Oh, yeah, yeah.
Okay,
Yeah,
that
Sure.
works.
That sounds,
That'll work.
yeah.
Yeah, because I would definitely like to limit our discussions next week, Wednesday at 2 PM to an hour or less.
Okay.
And that'd
I
be
would,
budget
I
related.
would
Sounds good,
suggest
Mr.
that,
Chair.
I would suggest that the Board of Health then also partake or Zoom in so they can listen to the board budget session next Wednesday.
Well, no, I understand that, but we all have busy schedules, and sometimes their schedules, if you're talking doctors, you're talking scientists, pharmacists, sometimes there are things that cannot be set aside.
I mean, for Wednesday, the budget
Yeah,
session. but
and
for
so
future, be-
I will definitely get the word and see if we can do everything within our power.
Thank
To
you.
do Wednesday at 2, and then we will schedule, hopefully, between the two of us, we'll agree to schedule a future meeting so that we can really have a good work session.
Good.
Maybe once
Okay.
we get vaccines and stuff going in the community and everybody can breathe a sigh of relief because we're okay on that path.
Okay, thank you.
We need more time. Thank you.
Mr. Chair, I'd also recommend that you loop Kayla in on those conversations as far as dates and times, so she can post it on the
Yes.
wall. So
Very good. Let's take a 5-minute recess.
Yeah. Are you going to take a?
All right, we can resume the meeting. Mr. Perry.
our next item up for conversation is our salaries. I had place marked 3% in those in the salary portion of it. And really, I would like a little bit, or a decision to be made based on the across-the-board percentage increase. I was running numbers with Amanda yesterday, and it seems as though if we lowered that to 2.75, if we kept it the same as we did last year, it would be a savings of $8,000.
Oh, you're just looking at places to make any reductions?
Yeah, and that was kind of what I was kind of discussing with Amanda. But again, the reason as far as the 3% goes, that's what the union's contracts are at this year. And I know last year we did just meet with, or we kept it along the same lines as the union. So
We
And I've
do
got-
Most of the time. We've been trying to do that, I think, for the most part.
I do
I
have,
didn't hear you, Linda.
I
What'd you
said,
say?
we've done that in previous
Oh,
years
yeah.
too. I said, for the
Yeah.
most part, that's kind of.
Well, and the worst part about, or not the worst, but the part we always forget is like the the sheriff and the difference in salaries, you know, I'd like to see where we get to a point where the lower salaries get a bigger raise than the top salaries, but the board does that.
well, that was one of my,
Agreement to us.
that was one of my questions. I think I know the answer. Maybe I should ask this of James beforehand, but it's good to ask it in publicly. We can't split this. For example, we can't say, no, supervisors get nothing, everybody else gets something.
Sure you can.
You can.
You can
You can.
supervisors, but they're the
Okay.
only ones.
Yeah, we've done different levels in the past
Yeah.
couple of years.
Yeah,
Supervisors, yeah.
yeah.
I can't support 3.5%. I mean, I can't.
That was the
So,
current board.
yeah,
So
so,
if that was the
so to
comp
answer, so to answer your question, what you can do is you can lower them incrementally, all the same.
Mm-hmm.
And then the supervisors would be the only difference. So if you wanted to lower that from 3.5 to 3, you can, everybody gets 3. If you wanted to lower that to, you know, whatever it is, that's all the same. It would then be even across the board as far as elected officials, so.
Is that, contracts are 3%, did you say?
Correct.
I would make a motion, we do a 3% across the board, and that would include elected officials, department heads, directors, non-bargaining.
I'll second that.
Okay, we have a motion and a second. Any discussion?
I'd love to see everybody get twice this amount, just because it's been such a bad year, and appreciate all their efforts, because as we said earlier, the health department's been doing a great job, but so have all the others working through this pandemic, but
Yeah,
aside
everybody
from
has.
that, it's just been.
Kind of keeping in tradition with what the union contracts come in at, we usually follow that direction.
Yeah.
You know, just, it's a double-edged sword in my book. I mean, it just pains me to give anybody an increase in these current times. On the other side, people have done a phenomenal job, so it's a tough one
Well,
for me.
and some of the people have been working through it,
Yeah.
you know, some of,
Yeah.
you know.
Well,
there's a
these
lot of-
union contracts, they've agreed to the 3-year deal, and I don't know what the first year started out at, but I know it wasn't 3%.
I think it was 2.5.
there were-
Yeah, it was 2.5 and then 2.75 and then 3.
Yeah, but there were some years where the 3-year contract, the first year didn't have any increase.
But there's
So-
steps and stuff included in that too, right, Amanda? So they get steps as well.
New hires, new hires into bargaining, they do get a more than that 3% because there are steps. And that ranges from union to union, it could be about 7%. And it just depends on the pay plan, but, so those that are not topped out, they are still getting an additional
Yeah.
kind of merit
Right.
step increase, so.
Was there any appetite for the board to go 3.5, or?
No, not for me.
That's what I'm.
There's a motion on the floor.
Yep.
All right,
There's a motion and
discussion.
a second.
Yep.
Mr. Veeder, would a roll call vote be more appropriate? Yes,
Oh, for
okay,
sure.
Mr. Veeder, roll call vote.
Leyland,
Yes.
Little,
Yes.
Schwartz,
Yes.
White,
No,
Trelka.
Yes,
Perfect.
all right.
One item done.
Can I just want to ask one thing quick, and it's not even really, just want to bring it up and to see if possibly for fiscal year '23, throughout, like, looking at the salaries that the department heads and directors, we do still have a little bit of where some are not on the GS scale. And I'm wondering if the board would be interested if I evaluated those that are not on the GS scale, which has kind of occurred as just like they've been grandfathered into at one time. Those salaries were set under a different compensation plan than what we currently use for non-bargaining. Would it be something that you guys would possibly entertain for fiscal year '23 if I was to evaluate those to see what they would look like on our GS scale so that they are handled similarly as to the director level, like the finance director, HR director, and building maintenance that our department heads or head of a department and
Yes,
Or on
I
a GS
support
scale.
that.
You're just asking for the look.
That has nothing to do with this year's budget.
no, nothing to do with this year's budget, not proposing anything,
Why not?
but
Can we think about that and get back with you? I mean, you don't need a decision today, you just pop that
no,
on.
I just wanted to put it out there so that I could possibly plan to look at that and bring something to you mid-year to at least just say we've evaluated it. Honestly, it may not change anybody's salary tremendously, and I'm really talking about 5 people. 3 of those report to autonomous boards, so I'd like to also, typically those autonomous boards follow Board of Supervisors policies, so I just kind of want to educate them as to whether this is something they want to do, and it's really just to bring in an alignment and a consistent compensation plan that we've been doing for non-bargaining now the past 3 years. So kind of the last phase of
Why
that.
don't you get that information to the board on who it does affect and how much the dollar amount is?
Well, and again, I'll have to, so then I can evaluate it, basically.
Takes a while.
Does that sound good?
Yes.
Okay,
Sounds
I can,
fair.
and plan to do that throughout this next year and hopefully
Yeah.
have you something in the next, probably shortly after the end of the fiscal year, so that we have time to plan for it and the departments can for
Yeah,
next fiscal
looks
year.
like there was,
Okay, that's all I had to say about that, unless there were any questions at all.
No, thank you.
Thank you.
James, on to capital, it looks like.
On to capital.
On the Capitol.
All right, let me share my screen here so Tom can take a look at what we're all looking at as well here. Tom, are you able to see that clearly, or would you like me to zoom
Sure.
in?
Excellent.
Perfect. So what I'll do is I will just go department by department, and if you have any questions, concerns, comments, anything like that, bring them up. And then what I'll do is at the very end, I'll just essentially ask that you guys officially decide on the capital and perhaps vote on it, so I can finalize that in the budget as well. So.
or if we have questions, we'll have to get back to you.
Yeah, absolutely. So I'm going to start it off with the attorney's office. Brian wants more desks or new desks in his department. All that $75 or $75,000, that is all coming out of fine collection. So that has no impact on the levy or anything. So he wanted to just let everybody know that that's really not affecting the levy, and it's coming out of his portion of the fine collections.
Well, I want to make a point there. I mean, that's a perfect example of keeping the board informed of money that's coming through our process, even though this has no impact upon our tax levy, correct? It's coming out of fine collection. But it's a
Yeah.
good example of us being informed.
How many desks, I guess it doesn't make any difference.
I don't have a good answer for you, honestly, Craig. I know.
One. No.
My only concerns is with all of this stuff is how much of it can wait with what is going on in the world, in all honesty.
Mm-hmm. And that's exactly why Brian didn't bring this up, especially on a regular capital item, because it is coming out of those fine collections. Those are, that's exactly what his thought mentality was too. On maybe a different year, he might have asked for it to not come out of fine collections. I don't know, and I don't want to speak for him, but that was a conversation that we had, and he said, you know what, fine collection is just fine with me. So,
Yeah, I understand that.
yep.
But it's like I said, it's not a good year for it.
Yeah.
How come maintenance is next? It's out of order.
I just wanted Rory to get out of the way, so.
I don't blame you.
So as it sits right now, we have a CIP fund, the 351 fund. There are 2 items in there, and I don't want to steal Rory's thunder, but one of them would be removed out of the capital item because they don't have you can't do 2 or both of them. So I'll let Rory kind of take it from here.
I say decommission that one elevator, Rory.
Okay, that's the discussion.
Well,
That's-
let's go through it. Yeah, I was gonna say, let's hear it.
No, that's exactly the one that I wanted to bring up. A few weeks back, we sent out, we meaning the maintenance department, had sent out a letter to the Pinecrest facility, just looking for input on the elevator, the smaller elevator over there. Several months back, we lost the hydraulics for that elevator. I had a company come in that does our monthly maintenance, and they gave us an estimate to repair it at roughly almost $54,000. So then at that time, I asked them what it would cost to decommission it, and that came in at roughly $4,500. So we asked the folks over at Pinecrest, just so I didn't overlook something in making a recommendation to the board, what their preference, if they use the elevator, is there any real reason why, we need this elevator? And so just to go through some of the feedback on that, health department They were really fine with it being decommissioned. They don't use it very often. They felt that it would actually make their 5th floor more secure by not having that elevator, having that second access up there. County Social Services, they were perfectly fine with it being decommissioned. They expressed that they hardly ever used it. DHS, although, came back with several bullet points. Primarily, just to kind of summarize it up, it had to do with handicap accessibility. So for an example, if the main elevator were to go down, how would folks get throughout the building? With that, I would say that we do have a maintenance agreement for our elevators, and we do have in there specified time to respond to any issues that come up. And I believe that's 2-hour response time. Looking back in history, that elevator, we have had issues, but the downtime's very minimal. And our outsourced company, again, is fairly quick on addressing those issues. The other issue that DHS had was COVID. Just having another elevator that staff could go up on versus the public. Again, and I'm just kind of summarizing some of these issues. Safety. And safety was kind of a broad one. They kind of went into several things, again, touching on COVID-19, separating staff from public, just giving more options to go throughout the building. So, with that said, the majority of the feedback we've gotten back from that building is that they would not miss the small elevator if we took it out of service.
Why is there even a cost to decommission it?
Because they have to literally go through and remove equipment per state. State has a code or an actual decommission guide that they have to follow, and they have to secure the door, basically make it so we can never try to utilize this elevator again. So it's a safety issue.
Is a recommission $4,400 too?
No.
Not.
The key word is never, unless we literally put in a whole new elevator, because they would come in and dismantle the equipment.
So it's your recommendation to take decommission?
Yeah, because I tried to figure out exactly why this elevator was put in, because it's not original to the building. I don't even have a date. I'm speculating it was probably back in the early 80s that was put in. And I never could find an exact reason why, other than giving it more
Probably for the
accessibility
doctors
throughout
and
the
the nurses
building.
and the nuns.
Yeah. So I guess with all that said and the feedback that we've gotten back from Pinecrest, my recommendation would be just to decommission this elevator, because in the long run, it would save us money also, because of the maintenance, yearly maintenance fee. That's one less elevator that we could put on our contract.
I agree.
Yeah.
Sounds
Yep.
good.
Okay?
Mm-hmm.
Then going back through, we talked a little bit about this the other day, but the emergency mass notification, basically what that is giving me the ability to add an additional 100 phones to tie into our all-call system. So in the event that we have to evacuate a building, it gives us more ability to get everybody's attention. And that's an add-on to our existing IP phone system.
I think in these current times, that's a good upgrade.
I'll give you an example. I mean, I think I might have talked about this, but our last evacuation, our bomb evacuation, and Craig, you can contest to this, you walked through the building to make sure everybody heard the evacuation. And there was quite a few
Still here.
that didn't know that was going on. So that's really what brought light to it. So our focus is both the courthouse and Pinecrest. If there's no other questions on that particular one, the next item I had on there was the dedicated equipment for Zoom. When I put this on here, this was before it was discovered that our speeds were significantly lower utilizing the existing connection that we had for internet up here. Within the last couple of weeks, we've made some changes to that, and we've definitely increased the speed of that upload, download time. I think we've got the sound resolved. I think people that are zooming in can hear better with us relocating the speaker. So I didn't put a dollar amount on this. I have found systems out there, and it really has to do with sound, better speakers, better mics, that type of thing. I guess I'm looking for some input. If you feel that we've hit that place where our Zoom meetings are going fairly smoothly now, or if you would want me to continue to look at improving it even more.
Tom, I guess you'd be a good judge of that. How have you been able to
Well,
communicate?
the cost is minimum really, and if we can improve it a little bit, I'm not so sure this year that Zoom still isn't going to be around in the future. Some of the departments said they were going to continue to use it for job bidding and so forth, so.
Do we have
I think
money?
it'd be-
Oh, sorry, Tom.
I think it'd be a good investment, I don't know.
Yep, I agree.
I don't know how much it was, but do we have money in the budget too to make some improvements now, do you think? Feel if we find there's something we could do now in this year? I'm thinking not just have to wait till July, but.
Well, this year we are a little tight due to COVID because we've had a lot of unexpected expenses due to all the plexiglass that we've installed, some of the other safety measures that we put into place. I would have to go back and really review that. I mean, I don't think, like Tom said, I don't think we're talking a huge amount of money here. I think that we can accomplish something to integrate with our existing system, and that may just be improving the mics, and I think we can accomplish that pretty inexpensively.
Since you had no dollar amount, what are you thinking?
I was originally going to put in $5,000 is
I think
where
we
I
can
was,
find
my
that.
target was.
Okay.
Yes.
For now, yeah, we can always take it out if we need to.
Okay.
Yeah, let's put it in. Or what's the board's pleasure? Do we need a vote on it, or? Do we have it?
Just give up.
I think we could vote at the very end,
Okay.
because that's what I would be looking at as far as
Just his
a
budget?
total capital dollar amount.
Okay.
All right.
We can always pull it out, before we certify.
The next item I put on there was a new salt and sand hopper spreader. Our existing one that we have, I didn't bring the date, but I believe it was 2012 when we bought it. It's really starting to show its wear and tear. The guys, our staff has done a great job in the spring, getting the chains lubricating and tucking it away for the off season. But we were a little nervous this year when we went to put it on the truck. It was a 50-50 whether we were going to get this thing to start running. With the salt really attacks the internal equipment of this sander. So I did put in a new one for next year. That is what I would consider a critical piece of equipment for us.
Yeah. Is there any way to protect that?
The new one that we've got, it's a much upgraded version. It's all poly. The existing one we have has got a lot of metal parts within it, and it's stainless steel on the exterior, which the stainless is holding up okay. It's just the metal parts that are the internal parts that are getting damaged. Not to mention it doesn't have a cover on it, and so any overflow of sand goes into our box of the trucks, and then it starts eating away those boxes, which we've already replaced one box because of that. So the new one that we have actually will come with a cover, come with a poly cover that will close, and when that cover is open, when you're putting the salt in, it basically acts as a protection to keep that from rolling off onto the truck. Computerized maintenance management system, and I know Kim had some monies in there for her staff as well, but this one, as a department, we're pretty excited about it. It's a work order system. We've been down this road before. We've had New World out there. We've done it for the last couple of years. It's really does not meet our needs as a department. It's just kind of a glorified email system. What we want to have in place is something that we can really put predictive maintenance on, For an example, we change our filters, let's say every 3 months in our air handlers. You put a work order in there, you put a predictive work order in there, and it kicks out and it generates that work order so you don't forget. It also provides history. So as we replace equipment, it gets documented and it makes it very easy to go back and look at the history of any kind of equipment that we worked on.
I thought you told us that's what New World did too.
New World did.
Sold it to us.
Yeah, and you're exactly right, and it was very upsetting. New World sold us the idea that they were going to add predictive maintenance as we move forward, and it's probably been how many years? 3 or 4 years, and they've yet to do that. So we want to jump ship from New World, and we want to have our own system.
Can't wait.
CI3 operating system, it's just simply a software upgrade to our head end units that control the HVAC system here at the courthouse. We're still on a Windows 7 based system, so that's just looking at upgrading that. Same as for the jail, we have the Honeywell Enterprise Building Integrator and jail's controls. Pretty much along the same lines, we're looking at upgrading that software. We've gotten to the point where, you know, the old story, we're going to get to the point where they won't support us anymore. Smoke head detector replacement. My staff has been telling me throughout this year, as smoke heads have been going out, that they're really getting brittle over there, and in talking with the sprinkler companies, we kind of felt that they have lived their expected lives. So that's just replacing all the smoke heads over at the jail.
Sorry, Rory, hang on. That is, that's in the sheriff
That's
total,
not in ours,
so
yeah.
Oh, you
that
put
is,
that on there?
yeah,
So-
let me scroll down here quick and
Sorry.
let me, no, that's okay.
I was just looking at my copy here.
He's just trying to get some extra money.
Yeah, because it's not, it's not on the sheet.
There, now it's on the
Hey,
board.
Rory, going back to that, sander,
Yeah,
would it help if we sprayed the beds of those trucks?
we do. We actually have them sprayed. We take them in and we have a liner put in them. And that salt, if it gets mixed with rain, it finds its way in there and it gets underneath that liner. We've actually, like I said, we've had to replace.
Rather than a liner, sprayed on liner.
It's a sprayed on liner that we put on.
How does it get underneath it?
Throughout the.
There's a lifetime guarantee on that stuff.
Well, the one that we had
ProLiner?
secondary roads, yeah, it's a ProLiner, I believe. We had secondary roads that got up underneath there at the tail end. It was extreme. They were able to come back at us and say that due to the extreme usage, because we were literally putting salt in the back of that, they were able to avoid that
All right,
cost.
thanks.
Just, it's similar to when you put a warranty on a pickup, but if you throw a plow on a pickup, there's exclusions in there that are going to probably get you into trouble when you try to claim warranty. Unless a truck is specifically made for that, which, where are we at?
Yeah.
Oh, electrical selective coordination arc flash study. What that is basically is I would reach out to an electrical engineer. We would work together and go through the facility and develop essentially an electrical one-line diagram. And what that means basically is it would tell us each breaker in that facility if it branches off and goes to another location. And the reason this came to light was a few months back, as we were putting the new boiler system in, one of the contractors tripped a breaker. And it was a breaker in the basement, which ultimately took out 911, their non-emergency center. And trying to trace down why it did this, it was really kind of a troublesome path and how it got to that point. And so it really brought to light to us that we need to get somebody in here and really simplify and explain to us where everything is tied in. An arc flash study is pretty common for facilities that essentially looks at each high voltage item, and it tells you, it does a calculation, and it will tell you what safety equipment you should be putting on before working on that piece of equipment. I did have, originally I had some items in there for the health department. I had met with the health department, a couple of them I feel that we can do in-house. For an example, some of the walls, we're starting to get some bubbling going on, similar to what we see here at the courthouse.
Where are we at here? I'm still under the sheriff. Where are you at?
I went off to the 5-year, just explaining, because since the health department is here, they're probably going to wonder why I did not put them on the list. So I just wanted to kind of bring that up before this question gets brought up. They had specifically asked if they could get new carpet on 5th floor. I went over, I reviewed the carpet. Typically, when I'm looking at carpet, I'm looking at safety. I'm looking at somewhat of a aesthetics point of view, but primarily safety. And I think we can get by a little longer with their carpet if we get it cleaned. So I bumped that up to a 2023 budget. They also requested that we repair some of the bubbling in the walls, which I believe we can do that in-house. So I did not allocate any capital monies to that as well. And then there also is a bathroom that in their clinic that they want to make handicap. I also feel we can do that in-house, pretty minimal. So I chose not to put that on the list.
Thank you.
Now, are they aware of that as well?
They are now.
Oh, I mean, other than, yeah.
No, I haven't had a chance to really go through that with Nafisa, but the last 6 months, we've been working pretty closely with the health department. I mean, we've done quite a bit of painting over there. They've actually did some remodeling in their reception area, and our staff would take care of the wiring for that. So I think there's quite a bit that we can handle in-house without having to push it back on a capital request. So, any other questions?
Thank you, Rory.
Thank you.
All right, we'll move on to the sheriff's department. I don't believe anybody is on from the sheriff's department. Rory touched base on what is coming out of the jail portion of it. That's room and board funds. And then the only other items that are on there are on his vehicle rotation, his car video, computer replacement that he does. He puts those in as they're replaced. A jail copier and bulletproof vests. Again, those are on there every year. He rotates investigations and civil, but
Board, the only
Is a good idea. If we don't do it this year, we need to think about it in the future very hard.
Is it something we could do for health, particular departments, like the health department? I would see that some of them.
I need to find out more about it, not knowing for sure how you felt about it, but.
And then do others later if we needed it or
Yeah.
whatever, or liked it. Okay.
I want to butt in a little bit on this one. This was
Okay.
also brought up on our audit from Clifton Larson Allen, so it wasn't an official,
Right.
I mean,
Well, how it
written
was
comment
worded.
or anything, but they did bring that up to as well as having a pass keep. So
Yeah. Because part of their suggestion was, in my little section, is to increase the length of passwords. So the more complicated we make it, the harder it is to remember, so.
So what does this passkeep management software do then?
It keeps track of you're gonna have to remember a password to get to your other passwords. And it's probably gonna be dual authentication where you have to have a text sent to you to say, hey, you're really who you are, that kind of thing, so.
Yeah.
And I don't know the specifics on how this one works exactly, but that's the thrust of it.
The older I get, the more complicated life becomes.
Doesn't it though? Yeah.
Okay.
Yeah.
Okay, and the Meraki wireless, I had that it could wait till next year on that. Now, that would be replacing all the wireless access points in the building. There's like 33 of them. And at the point we talked about they suggested it was like $600 a crack for each one. And then we'd have the management software to deal with it. Now, right now, we use Xeris, and it's pretty easy to manage.
And, you know, I don't know what people's experience are with whether we get better bandwidth with the Meraki equipment or not, but that's one I think we could wait if we needed to.
Would we not benefit by increased bandwidth
That's what I'm saying, I don't know that it would make that any better.
typically? I mean, oh, okay,
Okay.
you don't know that it would.
When they
because
did
we
the
need to-
assessment, we had several that were down, and when we refreshed, I shouldn't say, they needed to have some updates done. When ACES did that, people were saying things are better. So it may not have been as big a problem as they said.
I, for one, would prefer waiting.
Yeah, I'd say wait until we get the more technical knowledge of whether it is going to actually increase the bandwidth.
And I can follow up with that, make sure that we know, because,
That's just a one-time expense, right?
yes,
That's
we'd have
what we
maintenance on it, but
needed.
yeah, it isn't like,
So we could always.
For now.
amend. Yeah, for now.
yeah.
All right. So the two things it sounded like that you were recommending waiting, you were supporting
Yes.
for future. So, any thoughts on that, Tom?
I think that's all right.
To wait or go forward?
To wait or leave them on?
You know, it either do it now or wait, or it doesn't really make much difference to me. I can go with whatever the majority of the board decides.
I say wait.
All right.
Okay. Well, but let's keep this in mind, right? This is, what I've got this planned out of is that technology fund. This isn't the tax rate part of it. So if that makes a difference to how you're looking at it,
That does make a difference
It
for me.
does, Yeah. So
Yeah.
do it all. Can we get it all done? I guess that's the question. What's the
Well,
staff we have
yeah.
And what we need to do.
right. Well, like I said, I honestly think if we're gonna do the Office 365, we should get started on that this fiscal year, so,
Yeah.
yeah, I think, because I think that's gonna be the biggest thing, is getting that going.
Yeah, so basically, this would all come out of technology funds.
So what I have right now is we have in the back of our heads, we had about $60,000 fund balance reduction out of our technology fund. Anything that you pull, I mean, it's really going to depend. We can pull that out and still use 60,000 of fund balance, or if, for instance, the 14,000, if we were to pull that out of the 60,000 portion that we had kind of earmarked in the back of our heads, then, you know, we would be looking at 46,000 of fund balance. So depending on what you want to do, that was just kind of our I want to say placeholder. But again, we can earmark a solid $60,000 fund balance used out of the IT fund, and then anything that we do cut here potentially could just, you know, go from the tax levy as well. So
What's your recommendation, James?
my recommendation is to use 60,000 for IT fund balance, and anything else that we pull out of there would be lowering the amount that we need to levy for.
Anything additional, so 60 for sure, yeah.
How much is in the IT fund balance?
About 540.
Yeah, we got the money.
I like your recommendation.
I'd like to use more.
Yeah.
Just
Yeah,
because
60's
we're looking at cutting other places to get the levy lower. This is a place that we can do it and still get done what we're doing.
Yeah, again, I mean, as Kim had said too, the more that the more fund balance that we use this year is the more that we're going to have to levy for next year, because a lot of these things are on an annual basis.
Right.
So, you know, that's just something to kind of keep in mind is, you know, we could pull everything out of fund balance, but at the end of the day, then that's just
Well,
a
which-
gigantic increase for next year.
What beside office is on an annual basis?
Oh, well, the rest of them aren't as big a deal, but they all have maintenance on them.
Mm-hmm.
So, oh, the pass keep is annual. I'm sorry, yep.
Still, I think we could take more than 60,000 out of IT. We've got 500. I mean, just looking at trying to reduce some things, but that's just a possibility. And I don't know. Do we look at it with 60? I mean, we can take the 60 out and look at your budget and still change it on Tuesday. Oh, if that's when you're going to present to us and say, hey, take some more out of there and reduce down.
That's just more to decide, I'm worried about next week.
Yeah.
Not-
Hey, James,
You don't know how many hours this board worked for sessions, didn't they, Craig?
Really?
This is way reduced in time.
Yeah.
Tuesdays and Thursdays and.
First ones we sit on was like 5 hours a day.
And we've had a few where we've had to change it now because Tuesdays and Thursdays and throw in other days. Oh, yeah.
Yes.
We're moving quite well.
And then you had a full
James.
house.
Yeah.
the one thing is, I've got 360 up here on that EMC thing, replacement.
Mhm.
I think I have it in the 110 part, really, when I did the totals, when I entered it in. I think I didn't do that.
Yeah, this more corresponds with what, with how I want to present. The 360 for the EMC is something that you wanted, and then the suggestion part is all down below.
Right.
Yeah, so it's either way, I wouldn't worry about the 360 versus the 001. That's just where it's coming out of versus the levy rate. So
Yeah,
don't. Yeah.
Well, I just didn't want them to think the 360 was really supposed to be down in that area of where I put it in the budget.
Gotcha. Yeah.
Yeah.
Nope. That should be fine.
That's just for discussion purposes. Kind of.
Right. Well, actually, what I did was I put the bigger ticket items in the 360, and then my capitals looked like I was really going down, and this was going really high, so I thought, no, I'm gonna leave it where it belongs, so. But I must have not changed the actual number.
I think the 60,000 out of the IT fund is a good place to be.
Yeah, put it in for now. We can always change it. Because we may have to look at what we're levying for.
How did you come to the 60,000 number?
Because it was a $60,000 increase in our overall budget. So if we lowered fund balance by 60, it would be a flat budget increase.
Okay.
So it would be
So we could do
That's-
more. But we could do more.
Okay, so then what I said about that you're not taxing for this isn't really true, right?
everything below. Is that what you're asking?
Yeah.
Correct. Because, I mean, no matter what fund it comes out of, you're still going to have to levy for it. Now, out of 360, what you would do is when you levy for capital projects, and just like this 351 fund, we're gonna levy for it. We just transfer it out of the general fund into the capital improvement fund, and then pay for it out of there. So out of that 360, we're still gonna levy for it, and then
Okay.
we're just transferring it into your
I
fund.
just didn't want to make what I said be
No.
Gotcha.
right.
Yeah. Yep.
Yeah, bottom line, what the taxpayers have to pay is where we want to go. Yeah.
Mm-hmm.
Not the le- yeah. Okay.
So I will say, and then I thank you, and I remind you that next year I may have just as many items that we need to look at, because with IT, it's never going to be, it's always going to be, we're going to cost, but remembering that we're supporting all the departments, and even though it's coming out of my budget, each of the offices are getting benefit from, so.
Well, and I do like it that it was the assessment, like I said,
Yes,
it was
yep,
right, the
yep,
results and
yep.
responses of that, and we're making steps toward that.
And
That's
there-
a year off, Kim.
Huh?
That's a year off.
Oh.
Let's
I
take
just
care of
want you
this
to
year
remember-
first.
Let's worry about this year.
We'll see what we do next year.
I just want you to remember.
Remind us, you'll have to remind us.
But yes, I mean, and again, I appreciate having that assessment to tell you that what I've been trying to tell you is right, so.
Yeah, appreciate it.
Okay.
Thank you. Yep.
Can I back up quick? What are we taking out, or are we leaving everything else in other than
The Baumgar and what did we decide? At one point, we were gonna wait on Baumgar and Meraki, but I think they changed their mind again,
Then,
so.
yeah, Tom was kind of okay with doing it all, and I said, yeah, if we've got the money and we can take it out of there, I am, but,
Yep.
so we.
Who's the IT committee? You and Tom, right?
Chris and
Chris and
I'm on it.
Tom.
Oh, Chris
I
and,
was. I used to.
Yeah.
Chris and Tom.
Chris and Tom.
And I've got quite a little list of things for us to discuss, so I wanted to get together with them as soon as the dust settled, so.
What's
Wonder
your,
if you could get back to all of us, because I
Yep.
think this is such important. This
Yeah,
has
right,
been
right.
as the IT,
Yep,
so
yep.
having as much information as we can would be great.
James, did you want action taken on this so you know exactly what's going on?
Or do you get, if we don't do it?
Either now or at the very end. Either
I
one's fine
think
with
we
me.
need to start, I think we need to start making decisions instead of pushing everything off another day.
No, so let me be clear. I don't want to push it off another day. Of anything, whatever you guys want to do. If you want to make decisions based off of department, that's fine by me. Otherwise, what I would like to do at very least is to make one gigantic decision based off of the conversations that we've had for the entire capital list. Whatever, that's up to you guys. But no, I don't want to push this back another day, Tom.
yeah, I think we make a decision on the capital today.
Yes.
Right now, we go through it, we make notes, we look at that final number, and if anybody has concerns about the final number, we can always go back to a particular line,
Yeah,
right?
James can recap.
Okay.
kind of what you have understood, yeah.
Okay, so do we go through these one by one? Baumgar is a yes or a wait?
I think, aren't we all?
Well, I thought Baumgar was a no, but Marikey was a yes.
Okay. Okay,
I'm okay with the whole thing, so, yeah, decide what you want.
Maybe on this one we do a vote.
yeah.
I
Well,
was gonna
yeah.
say, do a vote and then you know what you got.
Yep, exactly. So,
All right,
is that the only thing you want to take out?
yes, Baumgar is the only thing I thought we were taking out. So on that specific,
What's the suggestion from the IT committee? They got all the knowledge on
Well,
this that they.
yeah, we haven't actually talked about this. I mean, it's
Oh.
more the assessment that, last year when we talked about it, we said, hey, you should put it in here, keep it in front of you, and if we had funding, to go ahead and do it, so.
Yeah.
and right now with the ACES contract, they cover this need.
Yes.
So we continue with them until otherwise.
Correct, that's my suggestion.
Now with the ACES contract, it is going to be up
Yeah.
June 30,
Right.
and then we are going to reevaluate that contract starting July 1 or whenever.
But we
So
still need the service.
yeah, so again, if because this budget starts July 1, that really coincides with that contract as well.
So if that brings up in another important
Yeah.
part of this, is the RFP that we need to come up with is gonna need to say,
Yeah.
hey, we need some remote desktop software. We need to have antivirus. We need to have web content. We need to have firewall as part of that. So if any of those things aren't included in whoever gets the RFP, I may have some things that we need to do to cover those. So
Yeah, then we
I
have
guess
to
I should
amend the
have, we
budget
should have thought about that a little
and
bit
use the
too.
capital improvements fund.
James, what's your recommendation on Baumgar?
I say we rip off the Band-Aid. It's one less thing that we include in the ACES contract for next year. And if it's something that we're going to plan on doing down the road anyway,
Get it in place.
just get it in place.
So the number we're looking at right now when it comes to funding is 124,828. Do we want to take a vote on that at this point?
So it's just leaving everything in or taking something?
It looks like the recommendation is to, on those bottom, how many items? And Tom, you can see this, right? 1, 2, 3, 4, 5, 6 items.
Yep.
Comes to a total of $124,828. Should we take a vote on that right now? Let's get it out of the way. I will make a motion, we do.
Second.
Second it.
Mr. Veeder, roll call vote.
Little,
Yes.
Schwartz,
Yes.
White,
Yes.
Leyland,
Yes.
Elka.
Yes.
Perfect. Thank you.
Thank you.
Thank you.
Clear as mud.
No, no, that's clear.
All right.
James, we're on to conservation, if
We
I'm
sure
not
are.
mistaken.
Mike, are you still on, or did you leave a long time ago?
Mike, are you there?
Yeah, I'm still here. Let me get my video.
Wake up.
I'm still here. Let me get my video going here. Can you hear me?
Yes.
Okay. You want me to go, James?
Yes, please.
Okay, from the top then. The Cedar Valley Nature Trails is 24,000 in every year, and it is utilized on the 16 miles of the Cedar Valley Nature Trail that are hard surface. That's for crack sealing, potholes that form. We get a lot of tree roots that grow underneath and raise humps into the trail. Sometimes those have to be cut out and redone. So we bid that out with companies, and we go as far as that 24,000 will take us. So the bid says, to the expenses would go up to the $24,000. And again, it's just resurfacing, crack sealing, and filling potholes and things like that. It's a way to keep up with what we already have, the 16 miles of hard surface that we already have. It does fall apart fairly quickly. So that's what that 24,000 is for. And it's in almost every budget that we send forward, every capital budget. And please, anybody stop me with questions as I go through here if you have questions. The Blackhawk Park shop wall repair. A couple of years ago, we noticed that one of the older facilities at Blackhawk Park, which house a lot of our equipment, our 2 dump trucks sit inside there. And I think that equipment, anything we can get inside, it'll make it last longer, keep the sun off of it, the winter off of it. But anyway, that building is one of the older buildings, but we noticed one of the uprights, one of the support systems in there had started to sag, and we noticed that the floor had cracked, and it was actually sinking in. In last year's budget, we put dollars in there to have an engineer come in and find out what was going on underneath there. That was the only way we were going to be able to figure out what we were going to be able to do. They did soil borings. They cut through the concrete and actually were able to get a camera in there and take a look. And what's happened is a sinkhole had developed under one of the supports. And it has continually gotten just a little bit bigger, but they have a system where they will, similar to, I don't want to call it mud jacking, but they have a system where they actually shoot a material almost like a foam. And so our estimate is that they'll come in and they'll just actually bore holes in that concrete, and they will bring that support back up so that doesn't get any worse. It's an old facility, but to try to replace it, the square footage and the amount of equipment we house in there, if we tried to rebuild something like that, it would be substantial. And so we're trying to stay away from that. The Rotary Reserve, the LEDs, the next 2 items, just kind of staying consistent with the alternative energy projects that we have in the county. A year ago, we updated, we changed all the lights in the headquarters to LEDs. The next heaviest use building would be the Rotary. And so we have a couple of dollar amounts there. One's for the building itself, the Rotary building itself, and that would be changing all the LEDs in the ceiling and throughout that building, or change the existing lights to LEDs, I'm sorry. And then we also have the parking lot and the lights that light the deck. Those are a sodium-filled light. They're somewhat antiquated. They obviously aren't as energy efficient as the LEDs. So we did get estimates on doing the parking lot also. And so you can see the building would be right around $17,000 and the parking lot would be $25,000. Our really big ticket item is next, the parking lot at the Rotary Reserve. Quite honestly, the reason I feel like this is pretty important is because I thought that the estimate would come in a lot higher than that. We do have the lane coming in, which is fairly lengthy. It's not quite a half mile, but it's very close. And then the parking lot itself is a 100-car parking lot. There's a lot of square footage there. The other thing that was going to add to the expense is around the parking lot lights out in the middle of the parking lot, we have a curb system, and then we have sidewalks, obviously, around the building. So we can't just come in and do it with the road at Hickory Hills this spring. That has to be ground down so that we can match it back up again. So it added to that. I'll be honest with you, based on other projects asphalt projects that we've worked with, I figured that would be a $250,000 project. It's been estimated to us at what you see, $143,000. So I feel like it's a really good bargain, and I don't know why it came in like that. I don't know if it's fuel cost. I don't know why our Hickory Hills Road came in as cheap as it did, but we're happy about it. And so maybe it's just simply one of those things where now's the time to strike. If fuel costs go up, I'm sure asphalt will go up too. But anyway, that's something that I feel really good about. I'd like to get it out of the way. That parking lot is 25 years old. We've been crack sealing it over the years. We've been filling in potholes. It's got a few minor areas where it's sinking in. And so this would dress that back up again. And my guess would be good for another 25 plus years, I would hope, if we take care of it the right way, and we will. On we go to some of the smaller items. The installation of the Hickory Hills Lakeview cabins, those things are so heavily used, but we have noticed that they're not very efficient from a heating standpoint. Al Fink has done some work. He's gotten up in them, and he's gotten some people out there to take a look at them. And this installation that we would like to try to do would really help with the heating costs for those cabins. And again, based on the fact that they're used 12 months out of the year and they're used heavily, we would like to get those a little more energy efficient. The air compressor is in the here at the headquarters with our mechanic. The air compressor that we've got out there, first of all, it was undersized when it was put in. It came from the other building. It came from Blackhawk Park. And so it's really just getting tired. So we're asking for an air compressor that would meet the mechanic's office needs a little bit better, or the mechanic shop's a little bit better. And so we did some research on that and feel like what we've put up there will cover that fairly well. Grapple tool for the tool cat. We just move so much brush and debris throughout the year. We've never had one. We rented one when we had the little problem with the windstorm in Blackhawk Park, the tornadoes, and they're just really a nice piece of tool to use. We do have a tool cat in the south unit. We have one in the north unit. That thing could float back and forth to both places when we have those windstorms and things like that. Just a very efficient tool to put on our tool cats. Our copier, it's just seen better days. I think it's on year 5, possibly year 6. Had a lot of copies made through it. We've had to do some repairs on it. The repairs on those copiers are expensive, and we just feel like now is the time maybe to look at something new instead of continue to put money into an old one. The grinder pumps, that's 2 grinder pumps. We have those grinder pump systems throughout all of our parks: Blackhawk Park, Hickory Hills Park, McFarland Park, and they simply send the sewage in Blackhawk Park's case, to the city of Cedar Falls sewer systems. But they're the same pumps used throughout the system. So what we like to do is we like to at least have 2 of them on our shelves if we have if one goes out. And typically, when do they go out? When we've got 100 campers in a campground and we can't move the sewage. So right now, our shelves are bare with those. We've used them all. We didn't ask for any last year, and so we're asking for 2 pumps, basically to go back on the shelf in case we need them for the upcoming camping season.
Is that the same pump that we use in Washburn?
I believe it is, Tom. I think they're pretty close to the same pump. Yep.
Where do you buy them at?
We get them through Allied. I think that company's out of Omaha. That's who's worked with. They helped us set all that up. When we started to have trouble with the first grinders that we had, they were a Myers pump, and we struggled with getting maintenance on those Myers pumps. And so we contacted Allied out of Omaha. We'd heard some good things about them, and they came out, and this has been years ago. They came out, went through our whole system with us, and they set us up with a new pump, and they made them consistent throughout the whole system. So it doesn't matter if one goes out at Hartman, we can grab one off the shelf at Blackhawk and take it over there. So they're all interchangeable. And
Mike, do you repair them, or you just replace with new?
We repair. We'll repair them until we can't do it anymore, and we've repaired quite a few of them. Normally, if we have one go down, especially if it's during the weekend, we'll drop one of the new ones in. We take the old one out, we go clean it up, we repair it, and we put it on the shelf, and it waits till it needs to go. If we have some that we can't repair ourselves, we will have Allied look at them, and then we don't discard them until they say they're not fixable. And we've fixed quite a few of them in the past. So
I'm going to say they're quite a bit cheaper than what we pay for in Washburn.
Yeah, they do a good job for us. Now, those Washburn pumps are probably doing a lot more gallons than what we're doing, but they work good for us. So, anyway, and they're easy to work on. We can do it ourselves. That's one of the other great things about it. The car trailer, this is geared more towards, a few years ago, we purchased that Terex, that forestry management piece of equipment. It's got the grinder head on it. It's got a shear. We use it all over in our prairies and our forest management on the Cedar Valley Nature Trail. We have a couple of trailers that we haul mowers on. They're always tied up in the summer, and invariably we need to move that thing. The trailers we have with the mowers are not heavy enough to haul the Terex. We're looking at a trailer that would haul that Terex. It would be a little more convenient for us to do it that way, and this would be like a 14,000 pound limit on it, and the one we have right now is a 7,000 pound limit. It'll haul 2 mowers really well, but not much more than that. So that's what we're looking at there. And then the mower and the truck, those are things you'll see every year. We try to rotate a mower out each and every year in our system, and that's, north unit, south unit all together. Normally, the mower that we are trading out, that we're replacing with a new one, is in the area of 5 to 6 years old. And we haven't had to put a lot of dollars back in them again. They haven't, worn themselves down to the point where we put a lot of dollars in them. And it seems to be a more efficient, economical way to move mower systems in and out and keep us going forward. So that's something you see every year. This truck would be in the north unit. It would be a Park Ranger patrol truck, and it would be replacing our old number. I know it doesn't mean anything. Our old number 94. I believe that pickup is a 1994 or 95 edition. I'd have to look at it for sure. That truck would then go in and be utilized for seasonal work. It would give them something to drive within the park systems. It wouldn't have to cover a lot of miles. We do have a truck older than our number 94, and that one will be put on gov.coms and sold. So one will be going out of the system if the new one comes in, and we do that each and every year. So
How many trucks do you have, pickups?
we have 14 pickups within the system.
How many employees you got driving?
We have people that would use those consist employees,
Okay.
seven park rangers, and then we've got our maintenance crew, and so right around 12 people use those pretty much daily.
Okay.
So I'm open to any questions that you guys have on any of these things, thoughts. I'm open for anything.
Mike, out of those 8 items out of Fund 001, is there anything you can live without this year? Or do you absolutely need all of these?
Dan, anything on there, I'm not going to tell you that anything's going to shut our system down. Those are the plain facts. And so if you guys felt like that we needed to pull something out, we'll find it. And things like the trailer, yeah, it has a need. If we didn't have it, would we stop using that piece of equipment? No. So again, a lot of these are just trying to stay ahead of the system, so to speak, and not let something completely break down to where we'd have to, use emergency funds to replace it. But that's what I'm here to listen to from you guys. If you're not comfortable with this, we'll find a way to make you that way.
It's refreshing to hear that.
I just thought that'd be a good question, Mike. It just seemed like one that'd be good. Yeah, conservation, with all the challenges we've faced over the year. All the departments did well, but we got fortunate. There was some luck involved, but also it was nice to see. We actually were able to generate some revenue beyond expectations in one particular department, and that was yours. So, and I appreciate the budget you brought forward.
Okay, thank you.
Any other questions of Mike?
Thank you, Mike.
Thanks, Mike.
Thank you.
All right, moving on. DHS budgeted for 4 replacement desks. That's $10,000. They do that every year. They keep their desks on rotation, and this year was not anything different. So
we haven't really seen them, we don't really look at it, we just know it's a rotation item, and I remember when we started doing that was a way to make the improvements, but.
yeah.
So you're gonna take these home and work with them? The desk?
And finally, we got the engineer.
James, I
Ryan.
asked for from the engineer a list priority of their capital equipment. See if we could trim that down. Did we receive that?
Yes, we did. Let me try to pull this up here quick for you, Tom.
While he's pulling that up, James, their capital is what, 1.1 million?
Let me see. Yeah, 1.1. All right, I got it pulled up. Let me start sharing again here.
So the list there is the order that we put for priority. I guess if there's questions on those, I know Kathy went over those pretty extensively with you guys here last week. Is there anything specifically you want us to cover or more detail on?
Well, personally, Ryan, the reason I asked for that list is, to be honest with you, I don't think I can support the 1.1 million. I'd rather see that dollar amount trimmed down. I don't know what the number is, roughly maybe 700,000, 800,000. And that's just me. I don't know how the other board members feel, but I think that's pretty high capital list. That's why I asked for the list. I'm not going to say which ones you need and what you don't, but I would like to see you trim that list down.
Well, and which ones, I guess we need to see, which ones really impact, I say, as far as budget and taxing. There were several of the items we talked about that weren't coming from tax.
Yeah, that was my question too. What impacts the
So,
levy?
None of these do.
none?
Correct.
So,
It's money that's not used for capital goes back into road use for roads and
yeah,
bridges.
that's what I thought
Correct.
they all do. So it really just, yeah.
Yeah, so from our standpoint, what we do is we deposit a certain dollar amount into the road use fund 120, as you see up there, and then they pull their funds for the capital projects out of that dollar amount. If we were to say, cut, let's say those $400,000 or whatever you want to cut out of this thing, it does not affect anything that we do on our end. So
It just is either in the fund or it's,
correct. Yeah, it's either a fund balance increase on their end or a decrease. I know Kathy had said something about a $3 million budget after this capital request. So if you were to cut $100,000 out of this budget, then it would be 3.1 million. So and those funds are really directly allocated towards secondary roads, and they cannot be pulled back into our funding source.
and they stay in roads. Yeah. Okay, thank you. Yeah.
Craig, any questions?
No.
Chris?
Oh. No questions.
No, I'm fine.
All right, our number we're looking at in regard to engineers is, the total number, if I'm not mistaken, is $2,265,000.
Yes. Now the difference between what you're looking at on the board right now is 050 versus 051. 051 is the construction side of things. So as that is capital, it's not necessarily the other capital that we're talking about. Now let me see if I can pull up the other one that I had prior, which does have the 051 in there as well.
Mm-hmm.
So up on the screen, you'll see 050 as well as 051. The engineer total, the 1.1 million that we saw earlier in the prioritized capital list. and then the 051, which is the construction total of 1.1.
All right. I don't have a concern with those numbers, but how do the rest of the I know Tom does, but where does everybody stand with what's being presented to us by engineers? My concern was always the tax levy.
Right.
Any other comments?
I'm fine with the list, just for that very reason, just because
Yeah.
it's secondary roads. It's
I understand it's, they know what they need, but sometimes I have a problem with their needs too. She talked about the lowboy trailer and the semi, and that PCI moves it for you, or does something for you.
That's currently what we have been doing.
Yeah.
So our
So-
crane, we do have PCI
Yeah.
haul to and from projects.
But how often do we use the crane?
Good question.
I would say we're probably going to move that, individual moves, we're probably going to move that thing at least 6 times a year. But then on the other end, our truck that we do currently have, our semi and our trailer, are getting a little older and we are having some issues with them. The trailer is getting to the point where there is some pretty good corrosion and issues with some structural portions of it. It's getting towards the end of its life. So, I mean, at some point we are going to have to replace the lowboy trailer. That does get used also for moving our excavator. The excavator is moved easily 20 plus times a year. We use it to haul our bridge beams out to the site. So every bridge we're hauling 4 of those beams. The trailer and the truck are used around the shop for moving those materials and storing the materials. We bring piling out to the sites. So it's yes going to cover a cost from what we wouldn't be paying someone to move the crane.
Right.
But at the end of the day, it's something that we're using throughout the year several times just to move excavators, move cranes, move materials. When we lease an excavator, we're using our truck to haul that equipment as well. So.
Mike from Conservation brought up a good point though, and I've told this to Kathy time and time again. All those vehicles sitting over there, sitting outside, during the winter, not used very much, and then out at the, out at the shed on Longfellow. That stuff, it's not meant to sit outside. It needs to be inside,
Yeah, and I know we do park as many of our vehicles
Yeah.
inside buildings as we can. We did take about half the vehicles that were down here, and they are parked in our cold storage building at Longfellow.
Right.
The ones we still have here are ones technicians are
Yeah.
still using to go inspect our projects that are still going on right now.
And the point she made was that, well, then you'd have to pick her up and take her out there. Well, that doesn't concern me.
Yeah,
That-
so like currently.
That way that truck ain't sitting over there out in bad weather.
Yep, so
Right?
currently, like I said.
That, and the thing with those vehicles, that semi and that trailer just didn't get bad all of a sudden. I tried to make that point to Wayne the other day. I said, they're not being taken, as far as I'm concerned, they're not being taken care of as well as they could be. When they come back in, we bought those power washers. We bought them for a reason. I can take any vehicle I've had and compare it to somebody else's vehicle that's had it the same amount of time. And most of the time, their vehicle's in way worse condition because they didn't take care of it. You see cars that are 2 or 3 years old on the road that, are all rusted out because they don't take the time or to take it to a car wash or to a power wash it off. And that, you'd be surprised how much longer a vehicle will last. Keeping that, and you guys know that from the stuff we use on the roads. That stuff's hard on a vehicle. And it is, I understand all that stuff's important, and all we're doing is taking away from a project that we might be able to do sooner, but she's prioritized, and that's her department. I can live with it somewhat.
I have no doubt that they need they can use all the equipment.
Right.
Actually, they could put another $1 million worth of capital
Yeah.
and show justification. My point is, the engineer's office consistently over the years has been over $1 million in capital, or close to it. And that's money that's being taken away from road use. You say it's not tax dollars, but in essence, it's money that's taken away from road use or bridges, which we turn bond for. We just bonded for a road, which is tax dollars, in bridges. So,
We
you
just
know,
had that, excuse me for.
are they
interrupting, Tom.
justifiable? Yeah, but I think their budgets of capital have been pretty lenient. The board has never cut them, to my knowledge, in the last 3 or 4 years on the $1 million capitals. That I think they can trim that down this year and take a breath. But I'm just one, so Dan, if we could have a vote on this, one way or the other, that way we can move on to the next one.
Okay, we will, we're looking at fund number 120, and we're going to look at agency 050 and 051. The balance in 050 is $1,105,000. The amount in 051 is $1,160,000. I will make a motion to approve.
I'll second.
Mr. Veeder, roll call vote, please.
Schwartz,
Yes.
White,
No.
Leyland,
Yes.
Little,
No,
Trelka.
Yes. James, there's, you have some fresh grand total capital numbers for us. I have
Yes,
those
I can
tabulated.
update these, but really what we're looking at is we're looking at removing 14,000 out of IT and about 48,000 out of maintenance. So I can update those numbers kind of live and if you give me a second, otherwise if you want to approve them.
And that was putting 5,000 into the
Yep.
dedicated equipment for Zoom, so you got that one? Okay.
Tabulate them,
So-
James, and
All
let's.
right, give me a second.
5,000 into what, Linda?
Show us the numbers. The Zoom.
Oh.
When we talked about the Zoom, we was 0 and they put 5 in there. No subject to change either. It is what it is, so pressure's on.
Yeah, I know, right? That's. I'll double check, triple check.
So
Yeah.
that's not what you said. It's okay, you can do that. We have other meetings, you might find some mistake somewhere else.
Quiet here.
Afternoon, we're ready for naps over here.
Well, we're making good progress.
Yeah, we are.
So I wondered if we needed to take a recess for lunch, but I think we can push forward unless anybody strongly feels different.
We just have
What do we
one
have
more
to
thing
do
on the.
there?
I'd rather push forward.
Yes, I agree. Yes.
Push forward.
Yeah.
what do we have left?
The board agencies, we gotta hash that out.
That won't take long.
Marines run toward the gunfire.
Yeah, and what's the rest?
And the Army.
Pardon me?
And the Army attached to the Marines, right, Mr. White?
They're not too smart, but they go forward.
He's pretty bold when he's on Zoom, huh?
Woo! How in the hell? Oh, this is my chair anyway.
Or at least they don't know all those technical terms that some do.
Well, I just avoid the words I can't pronounce.
Well, I do too, but apparently I got called out on that one.
There's a,
Well, that one was hard.
While we're waiting, I
Yes,
have
ma'am.
a couple suggestions. One of the things that they talked about is possibly getting Tom and Mike Hendrickson a better microphone and speaker, because that may be part of our problem why they're breaking up. So, I don't know, Tom, you're just using your laptop, right?
Yeah, everybody's been clear today. I've been hearing everybody,
Yeah.
unless they don't step up
Right.
to the mic.
You're the one that breaks up occasionally, though, so what I was told is that's something to look at, so maybe we want to invest in something and have you test that out, if you're going to be at home like that.
Hopefully next week I'll be back.
Okay, well, it's just something to think about, and that might not cost all that much, but might make a big
Is
improvement.
it something that we're gonna need to improve Zoom for the future, or?
Yeah, well, that's what they're saying, is that the quality of your speaker affects our our reception of what you're doing, so.
One time during the broadcast, I don't know if it was from your end or my end, but it said low internet connection.
Yeah, and that's probably, I've been writing down whenever that message came up, or whenever, there was a breakup, so that's part of my log for this, so.
I think when you
That's
see
the-
that, it's going to be on the end of where you're seeing it. So if you're seeing it, that's going to be on your end, Tom.
Right, right,
Um,
right.
We see it here, that's on the courthouse.
Yep.
Which is
Yeah.
where I usually see it.
But you would be a good one to try that with, is a better quality speaker.
Sounds
And don't you
good.
think that's been your experience, Chris, is when you were using your better equipment, we weren't having as much trouble with you?
Yeah, I think so.
Yep.
And you're still
And
working
it-
on
Kim, let me ask you a question. The
There you go, you're breaking up right now.
Yeah, there's a perfect example.
You're frozen.
You're frozen.
Yeah, we're not catching anything right now, Tom. And you're not blinking.
You're not
Can you hear me now?
We can hear you now.
Okay, Kim,
Oops.
like Rory, for an example, said in the future, he may use Zoom to do a job bidding, rather people coming in from out of town and so forth. Would they be doing that up here in our room, or they have capability elsewhere downstairs?
Right. They would be used in their offices, and generally, from his meetings, he's actually came up to the conference room because he's had other people in the room with him. But yeah, they'd stay in their own offices, and we want to make sure that people that are in their offices are using the cable and not the wireless, because that makes a way big difference on
Okay.
speed. So.
Okay,
You were working on a camera for my,
Right.
okay.
And so the other thing, and it just occurred to me yesterday, is, it isn't so much that you need to undo the, well, and this is something I need to talk to the department heads about, is the phone is the connection, so if you replace it to your laptop or whatever, instead of having to crawl around on the desktop, so, because I've got extra cables that we can provide to people, so.
sounds good.
Yes.
All right. Grand total capital with everything in there, 3,312,403. That is everything included. That's engineer, or all of engineer, all of the transfers to CIP, room and board, fine collection, everything.
And at the beginning of this session, we were presented with a grand total of $3,375,159, correct?
Correct.
All right. I will make a motion to approve $3,312,403.
Second.
Mr. V, discussion?
Well, I just one question. I just want to make sure I understand it all correctly. The transfer from CIP, that stuff you're planning on using capital improvement like reserve fund for. Is that correct? Or
No.
okay.
Nope.
We haven't had that conversation yet at all.
Okay.
Then.
I'm sorry, say that again.
So we haven't had that conversation yet at all about what we might potentially use for capital from reserves.
Correct.
Okay.
No matter what we use as far as fund dollars, that's not necessarily what we're acting on right now. What we're acting on right now is just the complete expenses.
Yep.
And then we can then talk about fund balance when we start talking about the levies and that kind of thing. So.
Okay. Very good.
Well,
Yep.
would you clarify, for a couple of those budgets, then you had like transfer to CIP or
Mhm.
non? Okay, Could you
Yep.
clarify what you meant by
Yeah,
that?
you bet. So everything that's on this capital list has to be levied for it unless we use fund balance. Now, for larger projects, say if so a perfect example is if conservation wants to do a bridge replacement and it's millions of dollars, then we're going to use that fund 351 to do that. And the reason why that is when we start looking at the operating capital for Mike's budget, I mean, before we started doing this, it was a roller coaster because he would have some of those large projects, and then it would skew all these numbers. And so you never really had a good idea of, what really is kind of on a rotational basis versus what is, just kind of the outliers or those projects. So the transfer to the CIP funds, those are just kind of the larger capital larger capital projects, and I can kind of go and kind of discuss. Let me.
There was just a couple of them that had that in there.
Right. Yep.
Yeah.
Yeah, that impacted two departments in particular, conservation.
Yeah. So what we do with that is we levy for all of these capital projects, minus the engineer. We only levy for the dollar amount that we actually propose. But so what we do is we actually make that transfer. So when we levy, I think the total CIP was like $418. So when we do that, we actually transfer that into Fund 351. And then we pay for those projects out of Fund 351, just as far as like an accounting standpoint, in a budgeting standpoint. And it's a little bit cleaner when we start presenting these budgets in situations like this. So, and again, that's going to be the exact same situation as far as IT. And again, we can start then using IT fund balance to kind of offset some of those spikes in those projects. Again, we can start using a little bit of capital funds if we wanted to do that to offset those costs as well. So it's really just kind of a budgeting tool, so to speak.
Thank you.
Okay.
All right, there is a motion on the floor. Mr. Veeder, roll call vote, please.
White,
Yes.
Leyland,
Yes?
Little,
No,
Schwartz,
Yes.
Trelka,
Yes. Board agencies, if I'm not mistaken, Mr. Perry.
Yes. All right. So what I'll do is I can, unless anybody wants a refresher, what I do is I just have a list of the board agencies that presented, and we can decide a dollar amount, or if you wanted to decide a dollar amount first and then allocate it out differently. But my plan was just to go through them one by one and get a vote.
I kind of broke it down a little bit. Maybe this will save a little time if we agree. So we currently it was 88,000 that we allocated last year, correct?
Correct.
So I'd be comfortable with proposing that we go with 100,000, and I have a breakdown based on that, and I've got a breakdown based on 88,000 as well. If we went to 100,000, I was proposing for the Friends of Casa 10,000, legal aid 25,000, the food bank 35,000, North Star 20,000, and Riverview 10,000. We didn't fund JSA last year. I think it's a good program, but it didn't seem compelling to what we do. And then if we were at 88,000, I was going to propose 8,000 for CASA, 22,000 for legal aid, 33,000 for the food bank, 18,000 for North Star, and 8,000 for Riverview.
All right.
I had different numbers than that, so, Dan, I think the easiest way to have, James, could you put them back up there now?
Yep.
Instead of capital? I think you ought to do is take it one line item at a time, and somebody can throw out a number and see if they get the support. And if it passes, we move on to the next one.
All right, James is going to put those up, and we'll take a look at them. I think that's a good suggestion.
Yeah, it's kind of.
We've done that in the past. That way we could cut through it and you get a second. If you don't get a second, then somebody else throws a different number out. Hold the vote. If you don't get a vote, we keep doing it till we get one.
Kind of like an auction.
All right. So first we have Friends of Iowa. They requested 20,000.
I'll make a motion for 10,000.
That's
There's a-
CASA, right?
That's CASA, correct.
Yeah.
There's a motion. Is there a second?
Second for discussion.
All right, is there discussion? I like Chris's number of 8,000. I'm being a foster parent. I'm a big advocate for CASA, but these are difficult with me, especially since when there are programs that municipalities aren't supporting but are receiving benefit from. That's the one thing I struggle with.
I agree.
But I can support $8,000, but I can't support 10,000.
Okay.
If you're willing to support,
What's the motion on the floor?
I made,
$10,000.
I made the motion for 10, but I'm willing to.
Is there a
amend-
second for that?
There was a second, yes.
I agree with you. Go ahead, Chris.
Okay, what I was trying to say, Tom, is I'm willing to amend that to 8,000 if that has the support here.
That I would support. Mr. White, are you willing to amend your second?
Yes, I am.
All right. Mr. Veeder, roll call vote. Any more discussion? Mr.
I think it's too high for a new, especially some of the items that they wanted, printing stuff, ink, things like that.
So.
Go ahead, we'll go with the
if this-
motion.
We'll do the motion. If it doesn't pass, we'll try another number.
So
Yep.
it's
Okay.
Schwartz White for 10,000. For
8,000.
8,000.
For 10 Friends of Iowa?
Yes.
Okay. Leyland? Leyland?
Oh, I'm sorry. No.
Little?
Tom?
No.
Schwartz?
Yes.
White?
Yes.
Trelka?
Yes. All right, that motion passes for $8,000 for CASA.
Next
Make a
is
motion
legal
to
aid.
Do 15,000 for legal aid.
Could we hold on just a minute? If you're going to make a motion on every one of these, I'm going to need to have a way to keep track of them.
Okay. We're going to take a brief recess while Grant
Okay.
gets the right tools. Or Mr. Veeder, I should say.
Grant's fine. Mr. Trelka. Would you say 15,000?
Okay.
The difficult thing is doing a roll call vote on every one and being able to keep track of that.
There's only six.
Just hold on.
Okay.
What's difficult? I'm trying.
Just a roll call vote on everyone, so he's just trying to come up with a more efficient way, it sounds like, to keep track of the votes and each individual organization and the amount.
Can everybody see what I have on the board? I have everybody on there, and then on the right-hand side in column J, I have the what we approve, and then at the bottom there, I have a running total. So we both we know not only
How much we got?
how much we allocated, but if you want to know how much we've allocated thus far, there's a total on the bottom there. So, and I can zoom in, or I can update that, whatever you guys want.
I think that's good right there, as long as Tom can see it okay. And I think one good caution, or an appropriate caution is once we vote on each one individually, when we get to that final number, it may be more difficult to go back. I mean, it's possible. We can.
I think Mr. Veeder might have a problem with that.
But, yeah. And for those above 50, we appreciate you increasing that font size, Mr. Perry.
I do what I can.
That's so you can see it, right, James?
Yeah, he's the one that said he.
Yeah,
couldn't
he's the
see
one with
the
bad
calendar.
eyes.
Easy.
He couldn't see the calendar earlier.
You didn't know there was a calendar back there. Tom said 15 on this.
That's the motion.
Somebody second that.
Not yet. We're, as soon as Mr. Veeder gives us the go-ahead.
So it was Linda and Tom were no on that one, right?
Yes. on
Correct.
eight, yes.
Okay, sorry, thank you, go ahead.
All right, and Mr. Little made a motion for 15,000 for Iowa legal aid. Is there a second? I will second it. discussion?
I'd just like to see it a little bit higher because I think they do a lot of work of getting people's back Social Security benefits paid to them, and that puts a big ease on the need that people need from general services here at the county.
Yeah. And they talked about the evictions and needing to address a lot of those too, so, yeah.
Last year, we did, it was 20,000
Yeah.
that we granted to them.
I could support 20.
My concern with some of these agencies is, again, they had promised that they were going to come to the board and give us updates throughout the year, and the only time we really see them is when they show up for the money.
You want to comment on that, James? I was going to say, we looked that up the other day in the application.
Yeah, I mean, as far as the application goes, it just requests that we ask them to, but it doesn't, I guess, say anything to what they agreed on, I suppose. But yeah, on the application side of things, it just said that per board, I can't remember.
But the
Well,
board
actually,
could
hey,
request
I have it right
it.
here.
The
Hang on.
board could request
I'll
it
just
at
read
any
it.
time.
I'll read it here. Grant funding must be used for project that was submitted on the application. Request to use funds or other purposes must be submitted and approved by the Board of Supervisors prior to use. At any time, the Board of Supervisors may request that an update on the progress of the project be presented to the board during public meetings. The board may request invoices or any other documentation of how funds were spent. All media releases, annual reports, and printed materials should credit Blackhawk County developmental funds. Again, that says that you guys may request it, but again, it doesn't necessarily say what they agreed to, so.
Now, Michelle has been here. She's been here at least a couple times from legal aid, because I know she's updated this, but
Right. Yeah.
I don't know how many.
And I can understand 15 to 20, but I can also understand for some reason these agencies sitting on nonprofits, we work with what we got and we get the job done too.
Are we ready to take a vote? We have a motion on the floor for 15,000 and a second. Mr. Veeder, roll call vote, please.
Little,
Yes.
Schwartz,
No.
White,
Yes.
Leyland,
No.
Jelka.
Yes. All right, that motion passes. I do like Mr. Schwartz's recommendation that he allocated none for junior achievement.
I agree.
And I agree with that. It sounds like we have 3-4 members that support moving on to the next agency. Let's move on to the food bank. Who would like to make a motion for an amount?
I'll make a motion for 33,000.
A second.
There's been a motion and a second. Discussion?
What was the dollar amount? I didn't hear it.
33,000. Last year, we allocated 30,000.
Okay.
Any other discussion? Mr. Veeder, roll call vote, please.
Wrong line, James, wrong line.
Oh, you're right, sorry.
Yep. I was gonna say, whoa,
You made it bigger.
there was a zero in there someplace. Schwartz,
Yes.
White? Yes. Leyland,
Yes.
Little,
Yes.
Jelka.
Yes. That motion passes, and we're at a total of 56,000. Last year, we allocated 88 total. North Star Community Services, would somebody like to make a motion on an amount?
20,000.
I'll second that.
Mr. White has made a motion for 20,000. It has been seconded by Mr. Schwartz. Discussion.
I'm not going to support this because the monies that we're going through today are a reflection from our solid waste monies. They ran out, so we're here today. One of the criterias with solid waste monies was it wasn't for infrastructure, it was for services. And that's what this money should be used for, is for services, not for infrastructure. So they indicated they have the state also in there. I know the parking lot's in bad shape. I've been out there a million times myself. It's a huge parking lot. It used to be a shopping center years ago. But I think our funding should be going for services and not for infrastructure. So I
Last
wouldn't,
year-
I would support anything. on
I
that.
sat on that board, Tom. And,
I know you do.
And the stuff they do, like I said, with all these agencies, they make do, and it's long overdue that we do something with that parking lot. I've been on it for a couple of years about it, and they do a fantastic job of fundraising, and they've done they've got 3/4 of the outside redone now, and it's really looking good. And the problem is, we haven't raised, that I recall, we haven't raised the rent on the people. I've been trying to get them to raise the rent, but then you got to take the chance of people moving out too.
No, it's a great organization, Craig. Don't get me wrong.
Oh,
I've
no,
been on it.
I know that.
I
Last
just
year,
have a concern with spending money for infrastructure.
Yeah.
last year we contributed 5,000 for the roof repair, so I said we did help with infrastructure last year, but
Yeah.
I said I'd support helping and so.
Yeah, and we did, and the total bill on that was 100 and some thousand. And this is a small portion of what the total cost. I think it's over 200,000 that'll be to fix. They were just.
Craig, are you guys getting any money from the state, seeing that they have an office there?
I'll let Miss Leyland answer that. She sits on that board. I got off of it
Parking lot's
because
still a mess.
they don't care for working people.
Well, I support the project, but I don't support the amount. I'd prefer a lesser amount, say
Yeah, I do
15,000.
too.
How much?
15, I know it's we're splitting hairs because it's only a $3,000 difference.
No, it's 5,000.
15, he said 20.
Five, Marine.
20 to 15.
Oh, 20.
20
I had
minus-
18 written.
20
down. I had
minus 15 is
yeah,
five.
yeah.
20 to 15.
Need a new crayon.
Yes.
You liking 15 better, Tom? Or not at all?
You know, if I still think that we ought to maybe someday down the road have a discussion on services compared to infrastructure.
I agree.
Because that's really what it's all about. You know, currently, you got to remember too, we do give money to community services for 3 agencies. So you look at this dollar amount we're allocating today, you got to throw on top another 80-some thousand dollars that's going to Operation Threshold, Eastside Ministerial, and Jesse Cosby. So,
Right.
you know, we are giving money to the community, but even in those 3 agencies there, it was specified services only, not even wages, just services. So I honestly think that we ought to stick to that guidelines that the solid waste money used also.
There's a motion on the floor for 20,000.
Okay.
Are we ready to?
I can remedy that. I'll drop it to 15, Mr. Trelka.
Who seconded that?
I did. I'll take that as a friendly amendment.
Okay, we're down to 15,000. Any more discussion? Mr. Veeder, roll call vote, please.
White? Yes.
Leyland?
Yes.
Little?
No.
Schwartz?
Yes.
Trelka?
Yes. Riverview Center, would somebody like to make a motion?
Make a motion, we approve the 5,000 we did last year.
Second.
All right, we have a motion and a second. Discussion? No discussion. Mr. Veeder, roll call vote, please, on $5,000.
Leyland?
Yes.
Little?
Yes.
Schwartz?
Yes.
White?
Yes.
Trelka?
Yes.
There's still room for my 5,000.
Or 3, whichever one you want to put.
No,
All right, our final number is
76.
$76,000.
All right. Well, that is all I had on the agenda today. I know it's kind of now getting into the afternoon, but I really do appreciate just sticking around and tackling these things. It makes it a lot easier on my end. The few things that I did want to just kind of recap and make sure that that when I come to the board on Tuesday to come up with a levy amount and an updated tax dollar that we're going to levy for, I do want to just make sure we're all on the same page here. First of all, did we all talk, or did we all, I mean, we all kind of nodded our heads, but lowering that medical examiner budget back down from the 40,000, we all kind of
Yes.
nodded,
Yes.
but
Yes, I
would
think we
like,
need to
I think so.
address that right now.
And Dr. Bickley was very supportive
Oh,
of
yeah.
that because of the year it was in.
Yeah.
Doesn't mean he won't want to revisit it again next year. And I
Yep.
thought it gives us some time to look closely, I guess, at some of those items, because we were talking a little bit about, what justifies increase in transportation costs or staffing
And
or
it,
investigations.
and it was, a couple of the employees thought they needed more money, wasn't it?
That
As
he
I recall.
was talking about.
So he's willing just to
He was, yeah.
pull the whole
And he was
$40,000
willing to-
request.
He was willing to come in too, Tom.
Yeah.
But yeah, he was
Yeah.
willing to wait, so if that.
All right, I think we can pull
let's do
pull
that
pull
then.
that $40,000.
Wait till next year.
From the budget.
Okay. All right, so I will adjust that. I will also leave the health department's budget alone until we get a little bit more clarification next Wednesday. Is that
Yes.
Yeah.
Yes.
also correct?
If not, we'll have to, if that doesn't work for people, we'll have to start, approving or disproving or whatever.
Okay.
we're gonna do. But yeah, let's try that.
Okay. Now,
So you'll be leaving all the budgets in, like, you'll be leaving that one as is for now then? Okay.
yes, yes.
Tom, was that the only other one you wanted to look at? Did you say you had two other ones that you wanted to look at?
No, the only other thing I was going to offer to the board, if they'd be interested in, I asked for that information the other day and James got it out,
Yeah.
is the board had taxed for the last 2 years, maybe 3 years, the backfill for commercial.
Right.
Obviously, the state fulfilled their promise and filled it 100%.
Yeah.
It's one of the reasons why the reserve is sitting so high. This year, we have $500,000 again budgeted that we're going to tax for. If the state, again, fulfills that, then you're throwing another $500,000 into the reserves. I don't know if there'd be any support to pull that 500,000 out of this budget.
I support that.
If they decide to cut back a third, or even if they cut back all of it, it's about $1 million. We certainly have it in our reserves. I mean, they're sitting at a ridiculous high of, I think he said 40-some%.
Well, not ridiculous, it's very comfortable, very strong, but yes.
That's way, way too high. We're taxing too much.
Well, that hasn't been because necessarily of taxing though, but it's just different budgets, different questions. But that's all right, Tom, I think there's support for it.
Yeah.
You got
Doing
over $1.5 million that you put in there that we taxed for a purpose and we didn't use it.
Yeah.
It just inflated that reserve.
Mr. Perry, do you have any concerns with that $500,000 request?
No, not necessarily. What that does, now keep in mind, that's not taking it out, it's adding to it. Because if we take it out on the revenue side, then it's increasing how much we levy for. Now, I want to be sure I hear you guys correctly. If we increase that dollar amount back to the $1 million that we typically usually budget for, then that is going to lower our levy rate.
Right.
Okay? And if that's what I'm hearing, that's what you want to do.
Yes.
If we take it out, then that is going to increase our levy rate because we would then not be getting that revenue.
I'm asking to leave the revenue of 1 million, if that's what we get a year from them in there.
Yes. Okay.
But
So I would
reduce-
be increasing
Reduce the
that
500,000
And reducing.
in the budget.
Yeah.
Okay.
Yeah.
So yes. All right.
Okay.
So they're clear, yeah.
Now, just to kind of put this in the back of your minds, we were increasing our levy amount roughly 520,000. So this actually does bring us close to zero.
Yes.
For an increase. So again, if I'm kind of getting a lot of nods,
Yeah,
but
no, I think this is the better way to do it than trying to squeeze more out of departments that have given us lean budgets. But,
Yeah, me too.
Well, this is a good,
and we will all lobby the state hard this year.
Yeah.
beg and plead, whatever we always usually do.
This will probably be the year they cut it completely.
Yeah.
Now,
They got the numbers.
now I a little forethought here is next year, assuming FY22 we do not get this backfill, then our next a year from today we will be at bare minimum $1 million increase in our budget. That's why I wanted to split it. But again,
Yeah.
if we're willing to kind of take that hit next year, then that's fine.
When we
But
take the $1 million hit, were we to take that, what does that put us at for reserves?
we have about, don't quote me on this because I don't have the book in front of me, but we have about $20 million unassigned fund balance in our reserves. That would bring that down roughly about 19. We also have the solar project that is coming in roughly about 950 some thousand. So we would be looking at a decrease between that dollar amount, roughly 2 million, little less than 2 million. We would be looking at, roughly 18,250,000, kind of give or take.
So in all fairness, probably we should, at least you can bring that back to us on Tuesday.
Yeah.
So we can
Yes.
reconfirm some
Right.
of all this.
And maybe, what I would maybe be open to is if taking this 500,000, or adding 500,000 back in revenue, basically to the budget, if that puts us below the 0 mark, as far as the percentage increase overall, I'd be interested in what the difference is, and maybe open to putting that much towards budgeting towards it, but just as an option. But for this year, I'd rather make that move than try to squeeze the departments anymore.
Well, and that's a great point. Honestly, is if that $0 amount is what, or excuse me, that 0% is what you guys are looking for.
Yeah.
We can do that. We can get there, and that's a perfect tool to use to get us at the 0% mark.
Yeah.
So, that's
Reserves was one, IT.
wherever.
was one,
Yeah.
any of
Yep.
those funds.
Right.
Wherever you guys want to land, I can get you there.
There's a couple of the larger capital things that may be appropriate to access reserves for too. Especially there's some large one-time things like conservation's only not gonna have to do that parking lot again for 25 years, for example, or and then even smaller things like the one-time expense on upgrading the phones for the emergency system and such.
Yeah, you're absolutely right. The only thing to kind of keep in mind is as far as the capital items, trend-wise, they are down. So if we use fund balance for that even on this year, and it is going to again increase next year. So no matter what we use as far as fund balance is, it's going to, I don't want to say kick us next year, but we are going to have to kind of go the other route next year. And in a year with very low capital, that is just kind of keep that in mind, is if people are holding off on capital projects, and then they bring a lot of capital projects next year, not only does that increase what we have, but it further increases from that standpoint. So
Good point. Yes.
so kind of keep that in mind. I'm all in favor of getting that to a 0% if that's what you so choose, and that'd
What's
be a
that
perfect way
reflect, that 500,000 in a percent wise? What would that reflect percent wise dropping?
Say that again, Tom.
Currently, you show about a 1.4%, 1.2% increase in urban.
Yep,
What's that in dollar amount?
about 515.
Yep.
So that's I guess that's what I'm trying to say too is, if we're lowering the medical examiner budget by 40,000 and putting that 500 back in for revenue, then we're already below 0.
Yeah.
So
I think we necessarily need to do a decrease, that's for sure, but if we can.
Yeah,
cut in-
if we can keep it level.
Yeah.
if we can keep it level, I can adjust these numbers and keep it level.
Accordingly.
Yeah.
I think and it sounds like the wishes of the board is
0.
0.
Zero increase. Not zero, yeah, no decrease. no
I
increase, yeah.
I
See a lot of
think-
head nods, but I just want to be
Yeah,
sure.
don't go ahead now,
Okay.
you're right, yeah.
Tom?
Tom's got some.
Just keep in mind, finance directors love those high reserves because it makes their job a lot easier. They don't have to work hard then.
So do the auditors, so do the bonding agencies, yeah, they all love it.
I mean,
The higher the reserves, the better they like it.
I'll just say, I'm comfortable with the 1.5, 1.4 that we're at right now. But if the choice is between trying to squeeze more out of some of these departments versus reducing what we're putting for the rollback. I'd rather see us change the rollback.
And that's the, and we've got interesting dynamics. I mean, we have to consider the whole budget. We're looking at so many factors, and you do bring up a good point, Chris. I mean, we're not particularly over scrutinizing one department, but we have to ask brutally honest, open questions so we can get to a point where we have to look at that final budget, that levy. And, you know, this does give me peace of mind right now at this moment where we're at, because I think we are in an enviable position for many counties and many cities.
Well, and that we got some good talking points when we do talk with the health department.
Right.
About, you know, the way they do business at the end of the year, which I don't agree with.
And our budget discussions this year reflect actions in upcoming years for department heads and their expectations and our expectations.
Well, the auditor said too, we were in a rather enviable position because of our strong reserves and able to weather some storms with this that other counties weren't able to, so.
I just don't want to see us get in a position where 10 years down the road, the auditor says, man, you guys are in rough shape.
Little because you did it, if
Yeah.
that's the case, so you don't want to be part of that.
Yeah.
Thing is, we've been there and done it.
Yeah.
Yeah.
Yeah,
it's
we
ugly,
weathered
but
the
you do it,
storms.
Yeah.
Yep. Some
Oh.
years.
All right.
Motion to adjourn.
Second.
All those in favor say aye.
Aye.
Opposed? We are adjourned.